35. Ms. Bender?
Yes, I'd like to call to order the King George County Service Authority Board of Directors.
Would like to rise for the invocation done by Supervisor Davis from the Dahlgren District, and then we'll stay standing for the Pledge of Allegiance. Thank you.
Heavenly Father, thank you for this time. Thank you for this day. Thank you for this life that truly is a gift. Lord, help us to represent this county in a way that glorifies you. Help us to make decisions in a way that glorifies you. Lead us and guide us. In Jesus' name, amen.
Allegiance to the flag, United States of America, to the republic for which it stands, one nation, God, indivisible, with liberty and justice for all.
Are there any amendments to the agenda? Davis? Yes, sir. Thank you. Public comment. Comments will be limited to 3 minutes per person in order to afford everyone an opportunity to speak. Please provide your full name and district when submitting your public comments so they can be properly included in the public record. First, we have the folks that have signed up. Pastor Davis.
Thank you for the opportunity. My name is Sherman Davis, pastor Tabernacle Baptist Church, 106 Old Kings Highway. I vote in the Dahlgren District. I'm going to be short and sweet tonight. I'm concerned about the survivors and the folks in North Carolina, South Carolina, and Georgia and Florida, what they're going through from the wrath of Helene. And I just want to read a couple of verses and encourage folks about helping. Tabernacle Baptist Church is going to be on the forefront there trying to help folks and interested in giving a contribution to help needy families. Then we will be tell you that every cent that comes in will be used for that purpose and no other purpose whatsoever. The scripture says, "A new commandment I give unto you, that ye love one another as I have loved you." Now that's quite a commandment, loving like Jesus loves, that ye also love one another. By this shall all men know that ye are my disciples, if ye have love one for another. The little book of Jude only has 25 verses, but they're all very, of course, serious verses. And Jude says, keep yourselves in the love of Christ, or the love of God. That is explainable next time, but taking the verses completely out of context probably, but it says, "And some have compassion, making a difference, and others save with fire, pulling them out of the fire," save with fear, pulling them out of the fire. And I'm just thinking in my own heart that using this verse to say that folks are definitely in the fire in North Carolina and South Carolina and Florida and Georgia, and things are going through devastation from the hurricane. And I want to encourage everyone to, what you can do to help and be able to encourage these folks that need our help. Seriously, love your neighbor. I don't care if you're a Democrat or Republican or independent or red, yellow, black, or white. They all need our help. Already been, I think they say it already, it's been 100 and some, 140 some already, 143 deaths we know about, and hundreds are still missing. So we need to do what we can do to help our neighbors. And God bless you. And if anyone has any questions, of course, I'm hanging around a little while. But anyway, to help those folks in need, and if they want to know the address, I got cards to give them if they want to know how to help. All right? God bless you, and thank you for your time.
Thank you so much. Pastor Shaw.
James Shaw, James Monroe District, columnist for the Northern Neck Sentinel, not speaking in my capacity as EDA member. New hat. Midwife. Bet none of you had that one on your bingo card. For you see, today marks the end of the first 9 months of this particular group of 5 members of the Board of Supervisors. The 10th month begins today. So let's look back briefly and see what all your hard labor and work has transpired, and along with that of staff, taxpayers, and other support people that have gestated and helped bring this to life. A traditional firehouse design was reworked to save taxpayers millions of dollars. A storage building was redesigned to save taxpayers a couple million. You held the line when it came to a tax increase with this year's 24-25 budget. You rescued from the jaws of oversight a $16 million grant that will help move things along with the service authority. You brought on a new county administrator with keen insight and experience. You widened the menu of data center vendors to bring healthy competition to this part of possible future business development. You invested some of the outstanding fund balances so that the county, instead of receiving $0, now receives $1,479.45 per day in interest. You are making positive efforts in making the budget presentation process more transparent and easier to read and understand. The courthouse, which in March was projected for a June opening, will now be occupied very soon, according to a presentation coming later this evening. I won't steal their thunder and am thus withholding specific dates. All these things have come to life through your service to the people of King George County over the past 9 months. Keep up the good work, everyone, and may God bless the King George Renaissance.
Thank you, sir. Is there anyone else in the audience that would like to make public comments? Seeing none, is there anyone online?
No, Mr. Chairman.
Is there any written correspondence? Right, sir.
So we all got this. I don't know if anybody wants to read it if it's in their district, but I'm more than happy to share it.
Yes, sir.
All right. Dear Supervisors, good evening. My name is Alan West. I live at 8700 Trumpet Court. I'm sorry I could not attend tonight's meeting in person. I'm a lifelong resident of the county and an owner of Westbrook Homes. I've had the pleasure of building hundreds of homes in the county in my career. I love what I do and enjoy working in the county. In 2023, we submitted 2 by right subdivision plans for review. During the time, the zoning and subdivision ordinances were being revised. The draft changes to the ordinances would have allowed us to be grandfathered under the old ordinances, but at the end of 2023, the language was revised, subsequently approved by the board in December of 2023, and our submission would have to go under the new ordinances. Needless to say, this was devastating. We spent hundreds of thousands of dollars on engineering and lost 2 years in the process in the county. Nevertheless, we tried to redesign our plans, but found that the new ordinances were fraught with engineering challenges. If you're familiar with the new ordinances, you might know some of these issues. I know that you have new staff on board and that they're going to work hard on trying to address some of the issues. However, I think that it will take a long time. It took me almost 2 years to update the ordinance, or it took almost 2 years to update the ordinances, and I don't think it's fair to have to wait another 2 years to fix the problem. So in July, we submitted a text amendment request to increase the block length. This is just one item that causes the most challenging obstacles to overcome. I don't want to take up a lot of time explaining the reasons here. I'm just hoping that when it comes to when I come to you for discussion, that you'll allow us to make our case through the appropriate process. Thank you. Respectfully, Alan West.
Alrighty. Is there anyone else receive any written comments? Seeing none. Alrighty. Reports of members of the board. Lee?
Sure. Thank you, Mr. Collins. Thank you, Pastor Davis. Thank you, Pastor Shaw, and everybody that's joined us this evening. We appreciate your time. I'll keep it short, so I don't have anything for the group this morning or this evening. Sorry.
Mr. Davis?
Thank you, sir. I'll keep mine short as well. Just want to say it was a really busy week in King George this past weekend, and it's good to see that a lot of people came out to different things. The Oktoberfest over at St. Paul's was a really big success for the 3rd year. I think that thing's just going to keep growing and growing and growing. Then they had the Jazz Festival as well, and homecoming football on Friday night, which I got to attend all of those. And it was a good time. It was good to see people out. I think ever since COVID hit, people are looking more and more for reasons to get out and do things like that. But I just want to say thank you for coming out. Thank you for being involved in your community, and thank you for supporting us.
Thank you, sir. Mr. Stroud?
Yes, sir. Thank you.
So I'd like to thank Pastor Davis for acknowledging the hurricane victims. Thank you, sir. That's devastating seeing on the news what's happened to those folks down there, and pray to God that never happens here to King George, and look forward to supporting them. Pastor Shaw, thank you, sir, for acknowledging and calling out the accomplishments. A lot of those are overlooked with a lot of people seeing the things that aren't done, or the things that need to be done, or they think need to be done, seem to rise to the top. So thank you very much, sir, for noticing and bringing that up. We've got a number of people that are asking questions, I guess, wherever I go, about the resolution regarding the preschool and the elementary school that they're voting on, and what should be done there. And I direct them to the school board for the answers that they need and they're looking for. So if people are looking for the answers there, I think that there's something up to the registrar's office as well, but the school board is where they need to go to get the answers regarding the attendance and so forth. I guess lastly, there's a lot going on in the world that people aren't paying attention, with the missiles fired from Iran into Israel, from Hezbollah into Lebanon into Israel, with port closures and a lot of things that are going on in the country. And think that it'd be a good time to not only make good with your maker, as Pastor Davis does, but also to be prepared as best you can. Think about what you need to do to prepare and take those necessary actions. We dealt with port closures and things like that during COVID, and there's an impact, and you don't want to wait until last minute to think about it. So with that, that's all I've got, sir. Thank you.
Thank you, sir. Sullins?
Thanks, sir. As always, I want to thank everybody for coming out. Pastor Davis, thank you for the kind words, and just helping us remember, that we've got things pretty good here, and maybe share, some of that blessing with our neighbors. Pastor Shaw, thank you for that summary. Sometimes I wonder if we're accomplishing anything up here, so I appreciate that read back, and I would ask for continued prayers because we've still got a lot of work to do. As far as on the report, not a lot. George Washington Regional Commission, Ms. Bender and I were able to attend that. Got to attend the Oktoberfest. That was probably the most fun thing I've done in a while. That was cool. I appreciate the church for putting that on. Some emails regarding the referendum, some schools and other community issues. And then finally, there's a thank you note from Mr. Norman Connor. He says, "I'm sorry it's taken so long to get back. I've been incredibly busy with work, but I wanted to say thank you all for fixing the bridge and making it more level. I know that many times people complain but never show appreciation, so I want to make sure I told you how grateful I am for you taking care of the matter. Best, Norman Connor." And that basically was to the board, as well as to Mr. Bill from VDOT for taking care of some bridge work that was over in his neck of the woods that was kind of needing some attention. So appreciate those positive feedbacks for everybody when you can bring them.
Ms. Bender?
Thank you. I want to thank everyone for coming out and watching online. I also want to thank Sheriff Giles and his staff for the excellent work they did with all the events on Saturday they had to cover and protect our citizens. I was at quite a few of those events, and I do appreciate their skill and their level of expertise at all the events. And it was a lot to handle because there was probably, if I'm correct, about 6 events in this county of high profile. So thank you to you and your staff and Fire and Rescue that attended the other events for their diligence in being there to protect our citizens. So thank you. As I said earlier, I was at the Jazz Fest, as St. Paul's Oktoberfest, homecoming, and the football game, all those lovely events that were great for our community in different ways. So I was happy to attend and meet and greet and talk to residents. Also got to go to the Eastern Virginia Groundwater Advisory Committee and learn a lot more about the SWIFT program and recharging the aquifer in Hampton Roads. I also met with DEQ quite a few times and with Norman DEQ, and we discussed water supply planning and water permits specifically, as Mr. Stroud likes to talk about, is the purple pipe. It's a lot more involved in the process of treating water, especially going to industry use. there's a two-step process, and we're still learning the details of it, but it has a little more complication. It's not as easy as you think. And we GWRC. And then two other things I'd like to mention is, Mr. Smolnik, could you check on the Rappahannock College Community Board? I think there's a position coming up. I spoke to Mr. Bushrod, who's on that. He would like to serve again, but I wasn't sure when the term goes up, so I make sure that I appoint him at the proper time. And I just wanted to invite everyone to my town hall here in this room tomorrow from 4 to 6 o'clock. It's a Q&A like the last time. You just come and ask questions and try to answer them to the best of my ability. So I encourage everybody to come out to the town hall and from 4 to 6. So thank you.
Thank you, Ms. Bender. All righty, we'll move on to Board of Supervisors consent agenda.
I'd like to make a motion to accept the consent agenda as presented.
Second.
Properly second. Is there any discussion?
None.
Already seeing none. All those in favor?
Isn't it right? Roll call.
By roll call. Mr. Davis?
Aye.
Mr. Stroud?
Aye.
Mr. Sullins?
Aye.
Ms. Bender?
Aye.
Chair votes aye. All righty.
All right. I'm going to take over with the Board of Directors. Can I have a motion on the consent agenda?
Move that we approve the consent agenda as presented in the overall agenda.
Do I have a second? Second. Motion properly second. Any further discussion? That being said, we'll do a roll call vote. Lee?
Aye.
Mr. Davis?
Aye.
Mr. Collins?
Aye.
Mr. Sullins?
Aye.
Chair votes aye. Motion carries. Now we'll move on to the heart of the agenda. First up, this is the King George County Service Authority regulations. This is a second read. Mr. Norm Rasavri, Senior Assistant to the King George County Board of Supervisors, will be talking about our regulations. Go ahead, Mr.
Okay, just a brief summary of what we discussed at the previous meeting. Basically, we've added an introductory section to the regulations for individuals, both for business and for personal residents, so that it would be easier for them to grasp an understanding of those regulations. We've updated the definition of apartment to conform with the Virginia Code. We've also provided a clear definition of equivalent residential connection to provide a better understanding for those individuals who are utilizing those regulations, so that things are a little bit clearer than they were written in some of the documents. We've also deleted the 5-inch, 6-inch, and 8-inch meters from the regulations, since they have not been used by the King George Service Authority. We've also clarified the application of the equivalent residential connection throughout the document that was not consistent previously. We also made clear the capital reserve fee per ERC has been modified to provide a better understanding for all of the users of the system, and should hopefully be generating the $60,000 annually that the revenue was lost. That is applicable to businesses in the number of EDUs. That is not a single resident is one ERC. So that really was affected by the businesses who have multiple EDUs. We've eliminated Section 31, the septic waste disposal, since the King George Service Authority discontinued acceptance of that several years ago, as most of the wastewater treatment plants throughout the Northern Neck in Eastern Virginia, with the exception of some very large plants that can handle that, because that's basically a disruptive element to an operating plant. We've also modified some of the penalties in working with the county attorney to conform to the Code of Virginia. We basically removed the criminal penalty sections that would be handled via the Sheriff's Department and Commonwealth Attorney if those situations would develop. And I don't know if Mr. Stewart has anything to add or not, but so the document should be clear for understanding for individuals who are looking to acquire utility services.
Thank you, Mr. Wasabi. I know you've worked very hard on this. Mr. Stewart, your staff have looked over it, and Mr. Eisenbeis and Patty, you've all contributed to some of the background and the history to it to make it a better streamline. Do I have any questions from the board on the regulations? No. All right, that being said, do I have a motion?
Move that we approve the draft King George Service Authority regulations as presented.
Do I have a second?
Second.
Yes, approve and adopt. Thank you.
Do I have a second again on that?
Second.
Second. So I have a motion properly second. Any further discussion? All those in favor say aye.
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 Any nays? Chair votes aye, motion carries. Thank you, everyone, for your hard work on that. Next up is the award of construction service agreement for the Potomac Landing Water Supply Well installation and testing. Ms. Kimberly Cook, procurement manager, and I know Mr. Eisenbeis and Mr. Young I'll probably be asking you to come up and answer some questions. Thank you.
Good evening, Madam Chair and members of the board. I am here to present the award of construction services agreement for Potomac Landing Water Supply Well installation and testing. Staff recommendation is to authorize the Service Authority Board of Directors designee to execute a construction services agreement with Toano Well and Pump Service Incorporated in the amount of $187,000, subject to approval as to form by the county attorney.
And just to clarify, which of the ARPA funds does this one come out of?
This is Virginia Department of Health.
Thank you. And why this is coming without is just in one read is because we have to have these awarded and put out to bid by December 1st. So there'll be a succession of ones that'll be coming until December 1st so that we can approve them and keep those funds. So does anyone have any questions? I know, Mr. Collins, you do. So would you like to go ahead?
Not for Ms. Cook.
Good afternoon. Good afternoon. Bryce Young, County Engineer.
All right, great. So my question, Mr. Young, is that, so there's a well on site there now that's been abandoned. And the reason it was abandoned because it was full of sand. So we're going to put another well right next to it.
Yes, sir. The well that is abandoned, the reason it's full of sand is because the screens failed within the well. So this new well, of course, have new screens and new casing, so it should get us some good, useful life out of that one.
Could you go down the old well and put a casing in it?
I don't think that would work out for this particular situation, and I believe the reason for that is you would have to go with a smaller casing, which then wouldn't allow you to have an appropriate size pump.
Okay, so the well that's going to be put in is different because of the casing.
It would be an appropriate size casing for the appropriate size pump for that well.
Is it going to be encased in, I was talking to Mr. Wasabi earlier about wells that they put in now, they in tile or some type of encasement so they can't.
Is the well going to be grouted? You know, Bryce?
It's in our specifications that were developed by TRC. I cannot say exactly, but I promise it is to the best construction standards of today's practices.
And I guess the last question is the money's coming from the ARPA. So,
yes,
so if it fails, it'll be coming from the ARPA money and not the county coffers.
This project is completely funded through ARPA reimbursements, VDH ARPA reimbursements.
Thank you. I have no further questions, Madam Chair.
Mr. Solons, did you have a question? I didn't get to you. No questions? All right, that with no more questions, do I have a motion?
Make a motion to approve the award of construction services agreement for the Potomac Landing water well installation and testing to Toano Pump and Well Service.
You have to, the amount correct, Mr. Stewart. You got to look up on the board there.
in the amount of $187,000.
Then just read the whole recommended action.
Got it. Make a motion to authorize the Service Authority Board of Directors designee to execute a construction services agreement with Tawana Well and Pump Services Incorporated in the amount of $187,000, subject to the approval as to from form by the county attorney.
Do I have a second?
Second.
With the motion properly seconded, any further discussion? Roll call vote. Lee?
Aye.
Mr. Davis?
Aye.
Mr. Collins?
Aye.
Mr. Solons?
Aye.
Chair votes aye, motion carries. Next up, award of construction service agreement for Arnold's Well A1 facility improvements. Ms. Kimberly Cook.
Procurement issued an invitation for bid to solicit responses for demolition of the existing Arnold's Corner Well 1A facilities and constructing a new well facility on the King George County owned site and the King George County Courthouse water system. 2 bids were received for this project. Power and Flow Solutions submitted the lowest bid. This project is funded through Virginia Department of Health ARPA funds. Staff recommendation is to authorize the Service Authority Board of Directors designee to execute a construction services agreement with Power and Flow Solutions in the amount of $371,305, subject to approval as to form by the county attorney.
Thank you. Does anybody have any questions on this one? Mr. Collins?
Not for Ms. Cook.
Mr. Young? Go ahead, Mr. Collins.
Why are we putting a new well there?
In this situation, it's actually not a new well. It is a new well house and infrastructure above ground. And this is, once the water gets out of the ground, there's a series of valves and such that allows you to dose your chlorine and such and then pump it off to the raised tower.
Okay. Did you, were you in consultation with the senior advisor to the board, Mr. Rosavi, on this?
Mr. Chairman, yes, we've discussed these projects.
Okay, thank you. That's all my questions.
Thank you, Bryce, for answering the question. Do I have a motion for approval or any further discussion? Any questions on it?
I'll make a motion. Authorize the Service Authority Board of Directors designee to execute a construction service agreement with Power and Flow Solutions LLC in the amount of $371,305, subject to approval as to form by the county attorney.
Thank you. Do I have a second?
Second.
Motion properly seconded. Any further discussion? Roll call vote. Lee?
Aye.
Mr. Davis?
Aye.
Mr. Collins?
Aye.
Mr. Solons? Chair votes aye, motion carries. Ms. Cook, I want to thank you and your staff. I know this has been a lot in a short amount of time, and Ms. Cobb and her, overall, the finance department and Mr. Young to get these all out to bid in a very short amount of time. So I do really appreciate it.
Thank you.
So thank you.
Thank you.
I also want to thank the admin staff too, because the easements have become a challenge, and our own service authority staff, Mr. Eisenmeister, Ms. Barker, and the audience, because this is a heavy load, and I do really appreciate what they've done to try to get this all done and everything we've been doing with the service authority and this very tight window we're on right now. So I want to thank everybody for that. Any further topics of discussion, I'll just give a brief report. Big thing is learning a lot of information about water supply planning. Mr. Rosavi has created a document to put out to bid for a water supply plan. This is something we should have. We should have had it for a while. We have sent it to DEQ to look it over to see if there's anything we've missed, and they're currently looking at it so we can put it out for bid. We did have a couple of conversations about reclaimed water, and it's a little more complicated. Mr. Rosavi, would you give a little brief what we learned?
Well, we've had several discussions with the DEQ central office and also with the regional officers that covers the King George area. And I think one of the things that became apparently clear is that we will have to amend the permits for the treatment plants where we are going to use reclaimed water to send back through the purple pipe to the various businesses. So the county service authority will be the responsible party. And once the users of that water, reclaimed water, they will have to prepare an engineering study to submit to the county's engineers for a review. Because the likelihood is that they're going to have to, we're going to have to pre-treat that water before we send it to them. And then depending on where they have a closed system or the multiple type systems that are used where they add chemicals, they may have to pre-treat that before they send it back to us to go through the system. So it's a little bit more complicated stuff. It's not impossible, and they've cited some examples in Northern Virginia on different projects that utilize that. But I think with all the restrictions of that's going to affect the aquifers and so forth, that this is going to become a more prevalent type thing throughout the Commonwealth, or at least especially over in the areas here where we're drawing on the aquifers that are having the issues.
Thank you, Mr. Fasave. That was a good summation. It's not overcoming. It's just, there's a lot more steps that we didn't know that were involved in the process. And talking with DEQ myself, especially going to the Eastern Virginia Groundwater Advisory Committee, they did bring up that there will be a new water supply plan going out, a state water supply plan. And there are more critical cells that have appeared in that time span, and there are some in King George. And so, and I got a lot more explanation of critical cells and why they're critical cells and land subsidence. I kind of downloaded in the SWIFT program that they're doing in Hampton Roads, which has a big price tag, but they're seeing some results, and they're going to be sending me some slides when they make them or approve them for public distribution is what I'll say. That's the term I was looking for. So we've done many things. A lot of it is information gathering in the last couple of weeks, which is very important to completely do that roadmap to success for the service authority. So is there any further questions from board members? All right, with that being said, I will open it up for secondary public comment to address meeting and business matters only. Comments will be limited to 3 minutes per person in order to afford everyone an opportunity to speak. Please provide your full name and district when submitting your public comment so that it can be properly recorded and included in the public record. Is there anybody in the audience that would like to come up? Is there anybody online?
No, Madam Chair.
All right. Is anybody else got any correspondence while they're here? There is one other thing I wanted to bring up. Ms. Cook and her staff did go out to the Presidential Lake site, and there is a lot of stuff there. And so it's going to take a little bit to figure out what we're going to do with that property. And I'll probably be bringing it up to the board because we've got to make a decision on the property there, the property itself, and what is contained there and how we dispose of it. Is that a good summation, Ms. Cook? Right, so I just wanted to make sure everybody knew we did follow up on that. Go ahead, Mr. Collins.
So when you say a lot of stuff, is there going to be some kind of list or some kind of inventory or something?
Well, I'll let Ms. Cook come up and give a couple of things that are on the site. She sent me a long list of things, so I can send that out to the board.
Yeah, I didn't get that.
I just got it today, so.
There are two sheds in dilapidated condition. There are 3 large water tanks. Those possibly could be scrapped. Then there is an additional water tank that's vertical and held together by rivets. So someone will have to get in there and physically take that apart. And it's probably about 7 to 8 feet tall. And then there is also pump equipment inside one of the sheds. And then the concrete. So there's a lot of things that will go into making sure that the site's completely clean of any remaining items.
Mr. Collins, you have a second question?
So can any of these items, these tanks or anything be reused? No pumps?
That would be Mr. Eisbei's question. Mr. Eisbei, can you come up? And I will make sure I send that out before we leave, everybody.
There's nothing, it's been just about everything there's been frozen. It's been out of commission for probably 15 years. So it's frozen. The pumps are all rusted. Filters have to come out. It's just a lot of scrap metal at this point.
Will it cost us money to get rid of it?
We can get a demolition company to take it for the scrap. It's really not a lot to tear down. It's just getting the right company. And clearing the land back up is going to be some expense.
Thank you.
Does anybody else have any questions on that? Thank you guys for coming up and answering that on the spot. With that being said, do I have a motion for adjournment?
I move that we adjourn until October 15th, 2024 at 5:30 p.m. in the boardroom of the Rivercomb Building.
Do I have a second? All right, we got a motion properly second. Any further discussion? All those in favor say aye.
Aye.
Chair votes aye. This Board of Directors meeting is adjourned. Mr. Collins?
Thank you. And I was aye on that too. I just didn't catch it. Alrighty. The next thing we'll have is the community health assessment, process and results, Mary Washington Hospital. Xavier Richardson. Mr. Richardson, how you doing? Good to see you. Haven't seen you in a while. And doctor, I never even attempt your name, sir. It's good to see you too, sir.
Yes, sir. Thank you. Good evening. And thank you, board members for allowing Xavier and myself talk to you today about our community health assessment that we're jointly carrying out. This is the second iteration of the community health assessment we'll be doing. Some of you were part of the chart that we did 3 years ago in 2021-22. And this chart is actually going to be the 2025 community health assessment. We're preparing in 2024 because, like anything good, the Olympian who's going to get a medal in 2028 is going to start now. So we're starting now early to get ready for our community health assessment. This is my agenda for today. I'm going to start with some key definitions and then talk. Those key definitions will lead me into the benefits of the community health assessment. Then I'll end with timelines and ways for the community to get involved in the process. What is health? The definition that I love to use is this 78-year-old definition from the World Health Organization. It talks about health as a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. And if you think about it, this definition is all-encompassing. Not only when it was adopted in 1946, but through time. If you think about today, this state of well-being, mental, physical, and social well-being includes everything from the physiological needs of shelter, sleep, food, but all the way to what we have today, needs of connection and internet, and all the social threads that tie us together between from those physiological needs all the way to the height of the Maslow's hierarchy of needs. And what becomes clear when we deep dive into this definition is that health is a shared responsibility. It's not an absence of illness. It's a shared responsibility that is not just for healthcare providers or the public health official, but it's a community participation, and that community is all encompassing. Everything from this narrative or this little picture is just a small slice of who is really involved in the community. Everything from hospitals like Mary Washington, public health agencies like us, nursing homes, home health, law enforcement, first responders, elected officials like yourselves, civic groups, faith institutions. The whole community is involved in this sense of well-being. So let me take a while here to talk, a second here to talk about the community that we mean, that we're going to be looking at for this community health assessment. Put simply, it's Planning District 16. It's very convenient. Planning District 16 is a footprint that we as a health department district cover, and also conveniently, Mary Washington, our great partner, also covers that district. Now, for this health assessment, because of our partnership with Mary Washington, and their catchment area includes certain parts of Orange County, Prince William County, and Westmoreland County, we are also going to be including those catchment areas in this community health assessment. But primarily, it will be the 5 localities of Planning District 16, King George, Caroline, Spotsy, Stafford, and the city of Fredericksburg. Going the wrong direction. All right. So now let's talk about a quick definition of what a community health assessment is. And what I will tell you is what it is not. It is not me or anybody from the health district coming and just giving you data. We will share data, but we will do it in a systematic way, engage with the community, get information from the community on what the community feels are the problems in the community and resources in the community. And then, most importantly, if you look at the third bullet in benefits, use all that information to develop a community health improvement plan. And so what is a community health improvement plan? Again, it is now, excuse me, deep diving in the process to create an action plan consistent of goals and strategies to address identified issues from the community health assessment. And it seeks to improve community health in a continuous and complex and collaborative way. Now, again, like I mentioned at the beginning, this is our second iteration of this process. In 2022, these are the community health improvement priorities and goals that we identified: mental health, affordable housing, and access to healthcare. And if those of you who are familiar with the CHIP process, we actually have strategies addressing all of these. I can spend an hour talking about strategies that we've been doing over the last 3 years for all the 3 priorities: mental health, the CSP, Mental Health America has done some great work in just training and identifying training resources in the community. For affordable housing, Micah Ministries is planning to build a Jeremiah community in Fredericksburg. The housing summit, the second housing summit, is going to be held in Fredericksburg for Planning District 16 later on this month. Access to healthcare, Germana Community College has started. They just graduated the first set of doulas to help low income and hard to reach women in childbirth, to bring them in and reduce that number of women who show up in the emergency room in labor and not having had any prenatal care. So again, like I said, I could spend an hour just talking about the goals, priorities and goals, and the activities we've done over the last 3 years. And so the strategy we use both in the community health assessment and improvement plan is a strategy called MAP, which is mobilizing for action through planning and partnerships. It is a continuous process. The first phase, which is a continuation of the third phase that we just finished, is the Building Community Health Improvement Foundation, which is part of what we're doing now with this sensitization and information process. Then the next phase, which I'm going to talk a bit about shortly, is the community partner, the assessments, the community partner assessment, status assessment, and context assessment. And then we move into developing improvement plans, and then coming back again in a few years to look at them. So to talk a bit about the 3 assessments that we'll be doing. The first will be the community status assessment. This is where we will present data to the community and get feedback on the data we present. A lot of the data that we'll be presenting are demographics, access to healthcare, just public health data. one data source that is I'm excited to be presenting in this iteration is social health, determinants of health data that Mary Washington has been collecting since the beginning of this year. And I haven't even had a chance to look at it, but I'm very interested in what that's going to tell us and how that's going to the community is going to respond to that. The second, once we're done with that, then we'll go into a qualitative data. These are more, this is where the interaction with the community comes in, and we'll get qualitative data on what the community thinks are its strengths, resources, assets, and the forces of change. Then the last assessment will be a survey to be completed by community partner organizations. When we're done with all these assessments, and I'll talk about timelines in a minute, we will put all this together and then present it to the community for public comment. And that leads me to the timeline. The kickoff meetings, which were started last month, we are having the King George kickoff meeting on the 15th of this month. And then we started with the surveys, which there'll be a link in the next page to how we can get the surveys. And then the focus groups will start once we receive back all the surveys, and then we can start the data presentation and the getting feedback from the community. Then after the focus groups, we'll then present to the community and get some more feedback, and then put the data together, and then have public comments. At the end of the public comments, when the chart is finalized, then we'll now start another set of meetings to start working on the improvement plan to get another set of 3 priorities. It could be the same 3 priorities, maybe just to do a bit more work, or 3 new priorities, or anything in between. And this, again, this is a timeline that by the end of July, we have a finalized community health improvement plan. So these are the ways to get involved, and this is why I wanted to be here today. The kickoff meeting, sorry, I said 15th. It's the 17th of this month, and that is the registration link. The surveys that we will be using in the focus groups and community meetings are also live, and there's a link to those as well. And then it's important, and we'll be sharing all these websites and all these dates with the county administrator to put on the county's website. As many individuals, as many people as can attend, and as many groups as can attend, the better. The products, the chart and the chip, are only as good as what's put into it. And if there is a group that has a need and we don't hear from them, we cannot put in there what we don't know or what we don't hear from. So that's the most important thing, as much participation as possible. And then when we're done with the community health assessment, also participation in the community health improvement plan. And again, like I said, we will be sharing dates of all these meetings with the county once we have all the dates set. I thank you for your time, and I will take any questions if you have any.
Alrighty, board member, you have any questions?
I do.
Mr. Davis.
Thank you, sir. Thank you for coming out. So I just want to kind of get to the bottom line of what we're looking to accomplish. And I appreciate you guys doing this. Is this something that we're looking at the end of the day where we can actually bring in structures to King George? Like, I mean, I could tell you some of the needs are our healthcare providers. People don't have a primary care. We've been trying for years to get an emergency room here, and we've been told constantly that our population doesn't handle it. Yet there's populations that have less than ours where there's emergency rooms. And with the map you're showing with Westmoreland and other places, I'm sure they'd like a quicker place to stop off. And I mean, if you do assessment here, those are the types of things we're looking at.
Yes. The short answer is yes. I mean, I can't speak to the specific need you spoke to, but those are the kind of things that in this process will come out. And if it's big enough, if it comes out as one of the priorities that the community wants to address, yes. And the beauty of the specific need you spoke to, the partner in the community that would be taking care of that is not only at the table, is actually here
Yes.
and is leading the process.
All right.
So
I can just let you know that's the biggest concerns that we get from constituents. Is the drive up. So it having something like that here. We need health providers with the surrounding counties we have that don't have one as well, who have to travel all the way up to Fredericksburg. And I know that some of the reluctance in that in the past has been the fact that I know that they don't want to lose our tax-paying dollars up there at their locations. It's more probably been a lot more about that than it has been about population per se. But if we're really looking at those are the needs that we would look at the end of the day people are going to want to address. When I ran, it was a big deal. Like, when are we ever going to get an emergency room here? Not even a full-blown hospital. When are we going to get primary care here? And our fire and rescue, our ambulance can drive to town, and that's great for them. But there's people that need medical attention faster, and that ambulance could be off the road for 3 hours. So it's a burden on us, the fact that those things aren't here in the community. And we're hoping always to partner with Mary Washington. They've been a part of this community for a long time. Even though we don't live there, everyone is part of Mary Washington and have used their health care and what they provide. And we'd like to see that grow probably and continue. But I thank you for your answers.
Thank you. Mr. Stroud, do you have a question?
Yes, sir, I do.
Go ahead, sir.
So what is the purpose? I've looked at the brief, I've listened to your brief. Why are you doing this?
we're doing this because this is two reasons. For us as public health, we are required to do it as part of our accreditation process. But the reason why we are required to do it as part of our accreditation process is because this is the way to identify what the needs of the community are, again, in a strategic way. So to go back to how I started, historically, how public health has responded is through things that we're mandated to do, right? We're mandated to give vaccines, we're mandated to do certain things. But that doesn't necessarily, is not necessarily what the community needs. This process makes us go into the community and, engage with the community in a strategic way to find out what the community needs, find out what the resources are in the community, hear things like what Mr. Davis said, and then actually try to connect resources with needs.
And again, I'm Xavier Richardson, Senior Vice President and Chief Development Officer at Mary Washington Healthcare. As a nonprofit healthcare system and hospital, we're required every 3 years to document the process of a community health needs assessment so that we can get information from the public in terms of what are the strategic priorities. And we have to report annually the progress that we've made in terms of addressing those issues. It's very important, particularly for us as a nonprofit hospital, the healthcare system, to meet the needs of the community, of the people that we serve. And the only way we can get it is through conducting such an assessment. For instance, quite frankly, we knew that housing was an issue, but we were a little surprised initially when we first heard that housing was one of the top 3 needs that the community felt were important. So therefore, we had to address it. And increasingly more so, we're seeing housing as an issue. I will say that the health department, I think you're required to do it every 5 years, but because we had such a good relationship and the process that we developed last year, one of the first probably in the Commonwealth of Virginia, where a nonprofit hospital partnered with the health department to do this, that we felt that we both wanted to do it again, and they agreed instead of waiting 5 years that they would do it every 3 years so that it would coincide with us. We do it also for the benefit of the community because the community was getting tired or maybe got a little needs assessment fatigue from having us come first and then a few months later having the health department to do it. And we think that it was together we came up with not only identified problems, but also solutions that we would not have done without coming together. And it's something that others are now looking at doing as well. But we also do it because it's the right thing to do, even if we were not required to do it. Now, one of the things that we identify by partnering with community organizations is sometimes the solutions that we might identify may not be the ones that come out of the collective assessment. And say, for instance, if we talk about access for care, it may be that not the solution may not be a facility that we can bring into the community, but it may mean working, for example, with the community health center that can bring together resources in this community because it's an underserved, not underserved population, but you may feel that you're medically underserved. And it may be the solution might be developing a community health center such as the one that's in Westmoreland. And of course, that's tied to federal grants, and it also can serve all types of people, both the medically indigent, but also those with full insurance. So by working with the community, we sometimes come with solutions that we otherwise would not have come with.
Talking about grants, most grants these days, especially federal grants, will ask if you have done a community health assessment. It's like in some cases the first question they ask. So this also helps if we're going in the direction of looking for a grant, especially with healthcare, but with other social services as well.
Okay, so thank you. There was a lot there to unpack on top of the questions you already had, because whenever I look at some of the calls that our ambulance have made and that our fire department makes, they spend a lot of time going to residences and they're treating headaches. Okay, they're treating, things that most people would just go buy aspirin or buy their own medicine, or some people go to the hospital for, but if they don't have insurance, they just call the ambulance. And we as the citizens are paying for more ambulances, or paying for more of our first responders to treat people that don't want to pay for insurance or don't want to go buy their own aspirin. Okay, so what I'm trying to find out is the WIFM of what you're doing. Is this is something that's mandated for you guys to do, to collect your own data, because you're a not-for-profit. And I understand not-for-profits, but they're not-for-profits that the people that work for not-for-profits get paid higher salaries than people that work for for-profit companies. So that just means that all the money you make needs to go somewhere other than for profit. So in this, people make choices. People's health choices are their personal decision. If I choose to use drugs, if I choose, and I don't mean once, but if I'm a repeat drug abuser, if I smoke cigarettes, then I think most people, even the government, has decided smoking cigarettes is bad for our health. But if I choose to do that, then, and I don't exercise, maybe my eating habits are bad, all these things that are bad, because in these surveys, these focus groups, and the people that you're looking to serve, they choose bad. And then there's people that choose good. Those are people like Bill that go to the gym every day, they exercise, they don't smoke, they don't use drugs and stuff. So whenever people come and they're asking us, and you're not doing that today, but ask us for money to help pay for things for the people that don't choose smartly, then that becomes an issue. So
get to your question, sir.
What Bill's asking is for what is going to do with the treatment facility. And I'm looking at the stuff in this brief. The goals are to enhance collaboration among traditional and non-traditional partners. There's a lot of words, there's goals, but it doesn't address having a facility here that cuts down our ambulance time. Nothing in the brief addresses those things that I saw. Quantitative secondary data, demographics, access to care, that stuff's available. people are still being treated by Mary Washington. All of our ambulances go there. If I go to the hospital, I go to Mary Washington. That's where our family goes. But it's traveling from here or from places more distant than here all the way to Fredericksburg. What we're asking about is putting a facility here so that whenever something happens, the ambulances don't have to drive further or people don't have to go further to get treated, that it's here instead of taking it all the way to Fredericksburg, Spotsy, or Stafford. That's my question.
Is your question, will they put a hospital here?
That's our goal.
Certainly, there are things that are required in order to build a hospital. First of all, there's a certificate of public need that has to be addressed. Certainly, there are other factors, and there's financial factors in terms of determining whether or not it's feasible to build a certain type of facility. But there are also other options too. And some of those things that you talked about are not necessarily choices, but sometimes it's based on availability of funds. I mean, sometimes people have to make decisions in terms of what foods they can afford to eat, because sometimes the least healthy foods are probably the ones that are the cheapest, and some of it's education. Some of these things are caused by mental health, which is one of the issues that we're dealing with here. Many people tell you homelessness, for instance, is sometimes determined by many of those persons have mental illnesses. So we're trying to get to the root cause of it, but we need to hear all the issues, such as the one that you just talked about, that people are calling the ambulance for a headache or things like that. Because some of the things that we've to learn is educating the community as well. And that can be part of the solution as well in terms of when to access care and when not to. And some of the telehealth issues, telehealth options are another way to address access. So we're looking at all of those possible solutions so for the betterment of the entire community.
So some of those, I mean,
Mr. Stroud, can I get some more people to ask questions and come back to you? Owens?
Sure, thanks. Good evening, gentlemen. Thanks for coming out tonight. I've only actually got one question. I'm curious about the focus groups. Can you give me some examples of what those are, or how they're chosen, or what groups you would like to hear from?
So, as diverse as possible. And that's why we're doing this as diverse as possible, to hear again to go back to what Mr. Stroud was saying, if we can hear what he's saying from as diverse a group as possible, then we can do a deeper dive into where are these pain points, so that when we go to the improvement plan, we can find out, okay, what are not only are the pain points, but also what are the resources in the community that we're overlooking that maybe we can bring to bear. And again, Mr. Stroud, if I can talk real quickly, you're correct. About 40 to 50% of health is due to behavior, but majority of behavior is driven by social and environmental factors that we can affect. So part of why we're doing this process is to try to identify those social factors that we can affect, and so that we're not pointing fingers and we're not saying you're making these bad choices, but we can find out why. The example I like to give is the babies are coming downstream, and we're trying to pull them out, and we're trying to find out what the social factors, what's the troll that's throwing the babies in the water in the first place. Those are the social factors that we can control, and whether it's us as the hospital, or us as the health department, or you as the board of supervisors, we can't kill the troll on our own. But if we work together as a group and find other partners, we can at least stop the babies ending in the water in the first place. That's the whole goal of trying to be a bit more strategic about this process. So we may end up with a facility. I don't control enough funds to talk like that, but in this process we may be able to find like I described, Germana through this process came up with a doula program just because in the process we were able to talk about data that showed that maternal mortality was high in our community, and that one of the strategies was to use a doula.
All right, let me get Ms. Bender, and then I'll be back to Mr. Stroud.
I have a comment and a question. So the comment quickly is, and I kind of see where Mr. Stroud and Mr. Davis are talking about, because you have people that travel on Route 3 going past the mall and they see all the emergency centers going on the way to Riverbend High School. And so they think, including myself, why do they have so many that are very close to each other and we can't even get one? So I think that's what some of the sentiment is. And my question is, for those that want to attend, what time and a little more information on the kickoff meeting?
We'll get that for you.
Okay, Mr. Stroud, go ahead with your next question, and we'll get an answer to Ms. Bender's question.
I guess it's kind of simple. Sir, I appreciate you. That was a good response you provided, and I do appreciate that. And look forward to talking to you more on that. To me, and I look at things differently than some people, but to me, I see hospitals in Stafford, Spotsy, and Fredericksburg. Granted, there's a lot of people there. We have a lot of people from the Northern Neck, and everybody in the Northern Neck goes to King George to get there. We could stop. Right now, it's a matter of our money or yours. Okay? You're not building, and I'm not you, but Mary Washington isn't building a facility here. Why should they? Our ambulances are bringing them to you. Okay? We pay for that. Why should they? I drive, my wife drives, our family drives our people to you, to your hospitals. We're coming to you. We're doing it on our time and our dime. We wait in your lines. We wait for your appointments. Not you, but Mary Washington. We have to wait. Okay? So what we're asking is, and what I know is that it's our money or yours. And right now you're spending our money, and we want to spend some of yours to put a facility here, so we stop spending all of our money. That's what we want. And the other thing is if Mary Washington isn't willing to spend their money to put something here, then that's where we go to the state and we say, or to somebody else and say, you know what? We need to break this union of the hospitals where they have this agreement of who can build where, and get somebody else to put a facility here so that we're not spending our money in Mary Washington. We're spending it, whoever's willing to spend their money to build a facility here, and we stop all that traffic from King George south on the Northern Neck. And I don't care if it's Mary Washington, as long as they have good doctors and they can treat our people here and save us money. That's all I got to say, sir.
Thank you, Mr. Stroud. So it's my turn now, sir. Okay. So the population of King George is 27,000. The population of Caroline is about the same.
31.
Westmoreland is 18. So we take those three numbers, and then you have some outliers, and then you also have population across the bridge from us, which is a large population. So
the naval base.
The naval base. So when you do your community needs assessment, it needs not just be the 16th region, but who actually is served by what facility is serving them. So what I'm saying is that Mr. Stroud is correct that everybody from King George and all the ones I just mentioned pretty much go to Mary Washington. And so we're not saying that. First, let me say, Mr. Richardson, that I've had excellent health care at Mary Washington, and just last Wednesday, and they've saved my life on numerous times. So I can't really beat the horse that kept me alive. But I would like for the health department, Mary Washington, VCU, University of Virginia, whatever healthcare systems, to actually do a needs assessment, and also do the certificate of public need for what the real need of the community is. What these things get skewed by Fredericksburg, Spotsylvania, and Stafford. But the real truth is that we're in need here in this community. So when Mr. Stroud spoke of money, I speak more of, so I'm having a heart attack, you're having a heart attack. You're a trauma victim, right? And it takes 30 minutes on a good day to get to Mary Washington. So if the rescue squad gets to you fast enough and they can take you there, they might be able to save your life. But if they can get you somewhere in King George in 5 minutes, they're more than likely to save your life. And then, of course, all health care providers know about the golden hour. Well, the golden hour can pretty much be up before you ever get out of King George. They got to bundle you and get you out of here. To get you to Mary Washington, they got to get there. So I'm asking you all to look at the population, not just of what you stated, but all around. And that the need is not just for hospital, it's also for mental health, children's mental health, and children's pediatric health. So we're lacking all that in King George. Also, when you look at all the data that you will be looking at, so what generally occurs in Mary Washington, if they take me in the ambulance, they bundle me up, they take me to Mary Washington, I die in King George in the back of an ambulance, but it actually goes to Fredericksburg's death rate because the doctor has to pronounce a death. So King George rate of death is skewed by that particular event. So we have more people that actually die in King George than is actually recorded. So a lot of these things on these needs is a little skewed, and we're asking you to look at the totality of all these things, because the number one thing that everyone tells us is we need a hospital. We need a hospital. Mr. Smolnick came on board, and the first thing we told him is we need a hospital. So whether it's Mary Washington, that's fine. Whether it's VCU, that's fine. Whether it's any of the other healthcare providers, but we need a hospital. So I don't know how you get to those numbers. How do you get to the certificate of public need for King George? But for the fifth time, I say we need a hospital. So, Doctor and Mr. Richardson, I would encourage you to have some conversations with the county administrator so you can tell us about the hospital that's coming. So that's my message. I think it's the rest of the board's message too, that we're in dire need of facilities. So you also think about primary care providers. There are few, and they don't. So we have Mary Washington down in the Dahlgren area, and we have Mary Washington Clinic up here and Mary Washington there. But there is a real need. I know there's a need in the rest of the country for primary care providers too, but the numbers are great in our region, not Spotsylvania and Stafford. They already got what they need. They have 2 hospitals. So we're asking you to take a deep dive into this and take a look at the numbers. I will be there when I know what time it is.
It is now. I don't think it's from 11 to 2, but my staff has a way of putting an earlier hour on my calendar so that I will arrive on time. But it's from 12 to 2 at the Citizen, I guess, Citizen Center, King George Citizen Center, King Highway. I'm a senior in there.
So the partners to get there would be like veterans and social services and all the seniors and all these other folks. And then, but the people that work, that'd be a tough time. So could there be an evening event also?
There's a virtual,
Correct.
one as well.
At the end.
We'll get you the date. We'll get the entire calendar. Because if they can't make it to the King George one, they can make it to Carolina one, or they can make it Thursday to Pennsylvania one. We're going through the same process. We will certainly be back out in the community again as well. But certainly we're looking for solutions. We've heard some of the issues. Part of the solutions for rural areas and even some urban areas is the use of telemedicine. We're even looking at some solutions in terms of having telemedicine whereby the student or child is in the school can communicate with the doctor through telecommunication means. The same thing is being done across the country for mental health services. There's a shortage of mental health personnel, so a lot of people are doing that. We are doing things to increase the number of medical professionals in our community. We have a graduate management education program, and in 5 years we should have about 500 different graduate students working in our community, and perhaps there will be opportunity to do more rural and work. And I know that the health department has a mobile van that they received a grant for that will be out in the community and will allow different community organizations, nonprofits to use it. It doesn't have to be the health department. So we are looking at ways to improve access, and hopefully with our graduate management education, we'll increase the number of providers in the community as well.
So when you brought up that topic about the investment, I keep pretty good track of what's going on up there, and the investment that you're making up there in that campus is huge. We're just asking for you to make an investment down in the northern neck. So,
and some of the investment that we're planning now is to provide to what's required, basically the need to house and to train those GME students who can then go out in the community. More than studies have shown that people tend to, a large percentage of them tend to stay in the community where they do their training, and we hope to have more providers throughout this area. And I will certainly communicate those concerns that you have articulated here this evening to the staff that's responsible for the strategic planning area that goes out and determines feasibility of placing healthcare facilities in certain areas. And it does require a certain amount of patience. So like we don't have a children's hospital in Parkersburg, so we don't have enough patients there to support that. The same thing with a lot of rural hospitals. Sadly, some of them are closing because they don't have enough patients to be able to meet the increasing costs of operating a facility. But we certainly will take this back because we know that this is something we're concerned about, and we will take it back to our strategic planning area as feedback from this side.
Mr.
the
Chair.
last thing that I wanted to say was, so when you go through this information, you have to look at, so I don't know if you all have availability, or we can make available our calls for service for the rescue squad. And one of those calls for services that are huge is lift assistance. So you take a crew to go lift someone off the restroom to get them into the chair. And so this happens every day, many, many times a day. And everybody has limited resources, as Mr. Stroud said. And we're no different than that. But one of the priorities of the board has been to get a hospital. And we don't care where it comes from. But, we would love to see it down here. Mr. Stroud, you have one more question so we can close this
Mr.
out?
Collins, if I can address that real quick. That specific example, the answer may not be, I know the community needs a hospital, but the answer to that may not be a hospital.
No, I wasn't saying that. I
Yeah.
was saying in your needs assessment. So when the health department does this needs assessment, they can see that there's large numbers of people in King George that are using that rescue for lift assistance. So you can invest money in that, in a program to help people and not use the rescue squad for lift assistance. That's all I was saying. Look at all the different things.
Exactly.
Yeah.
That's why we need to hear from everyone. Because sometimes there are things that we aren't aware of. Until we look at the data or documented it, we needed to address the discrepancies and outcomes. And then when our community partner said, hey, we will do things because they were at the table as well. Germanic Community College. I'm sorry.
Yeah, that's okay. Well, sometimes King George doesn't feel like we're part of that community in that region because all the road money goes up there and we don't get services. So just understand where we're coming
I will
from.
tell you that you are important to us. We have community benefit grants, and we've been working with some of the organizations in King George to provide them with grants. And this comes from our foundation. This is something that's unique because most nonprofit hospitals don't provide grants. Typically, the president of a foundation like myself would be responsible solely for raising money for the hospital, but instead, we also award about over $1 million a year in grants to the community. We're looking forward to working with your Director of Social Services. We've been in some meetings with them. We've helped the local pantry or food pantry that provides free food, fruits and vegetables to members of King George. So we do care about King George. Otherwise, we wouldn't be out here today.
So, Mr. Stroud, you had another question?
Well, so yeah, I'm wondering like where this is really coming from, because you had mentioned the third top issue was housing, and the data for what and who in King George and who out here gets treated and what they get treated for, the hospital has all that data. Okay, every time one of us goes in, we have to fill out 5 to 6 sheets of paper every time, even though we filled it out the last time, on from what our medicines are, where we were treated at, the last time we were seen, whether we left the country, whether somebody else in our family's sick. All that data rests at the hospital. Every time somebody goes, they have to fill that data out. The hospital has that data, and the hospital has IT systems capable of capturing that data and reporting on it. So the hospital has all that data. It's got the zip code, it's got our address, you've got our names, you've got everybody, you've got all that data already. I don't know what you're doing with that data and how it relates to this survey, but you've got all that data. So I'm interested on this at this kickoff of what questions you're going to be asking that are going to provide medical related, I mean, this community health improvement plan. The data already exists. So, and I guess my question is, where and who is asking or who's saying that the number 3 issue we have in King George is housing? Who are they?
So the data is presented, like I talked about, it's presented, and then it's in the process of interacting with the community will come up with the 3 priorities. So it's and it will be based on the data and what the community feels it's important and what the resources it has to address it. So one of the 3 priorities, for example, was deliberately kept as large as possible. And the 3 priorities in 2022, we deliberately kept as large as possible and said access to healthcare, not hospital or access to healthcare, which covers a very broad range. And with that big bucket, we're able to use that data to write the grant that got the mobile clinic, We're able to do the doula program. We're able to do some to identify training needs for community health workers. So it's a process, and the data does come into play in that process. And like I said, in this iteration of the chart, we are going to use the social determinants data that the hospital is generating. So when the process starts, if there's data we present and you want something else or you want a deeper dive on what we present, that's why we need participation of as many people as possible.
And the data that he's talking about the social determinants of health. Just in this beginning January 1st, every inpatient who goes into a hospital in the United States has to be assessed for 5 social determinants of health. One is food insecurity, housing, transportation, utilities, and safety. And we're already taking that information. All we're required to do is to show that we conducted the assessment. But we already have developed relationships through our community benefit funds with partnering organizations, and we're already beginning to address those things. We haven't had a year of collection of the data. One of the things we found is food insecurity is something that a lot of people go through. It's not obvious to all of us that people, there have been doctors in these United States, retired doctors, who were found to be had food insecurity because they didn't have enough money left over after paying rent and everything else to purchase healthy food, and they've had to have a prescription to purchase these things. In our community, we found a lot of people indicate that they have they are insecure relative to their food. So what we're doing now is anyone who tells us that they have food insecurity, then we're connecting them with the food bank, or in Stafford County Serve, or a provider, or in King George, we can hook them up with a pantry. I've forgotten the name of the organization. We've met with them. So we can refer them to them for services. But we also have a relationship with the food bank, and the food bank is providing us with groceries, bags of groceries that we give to those patients as they leave. Eventually, we're going to be able to give them fresh produce. And eventually, and beyond that, we hope to give them frozen meals that they can take care of. Those are some of the root causes of some of the people who come through our hospitals, because if they have food insecurity, they're likely to come back to us again. But we're doing this because of our relationships that we have with others. So we need to hear about what others are doing in the community, their church pantries and all that. We don't know all of these things, and that's why we have to bring some of the providers to the table. So that's why we need to hear from everyone. We need to hear what your issues, what your concerns are, and some of these things that are not obvious because that data may not be collected. But from the data that we have, we do try to address them relative to social determinants of health.
So, Mr. Richardson, so we're going to tie this one up. But you said that the hospital asked those 5 questions.
Yes,
I've never been asked those questions.
Have you been in the hospital since January 1st?
Absolutely.
Well, perhaps.
Never have I ever been asked any of those 5 questions. Anyhow,
Okay.
we're going to wrap this up.
Well, maybe a family member asked them.
So, Mr. Stroud was speaking of, and you were speaking a lot about folks that are in need of services, and our population that's considered, our median income is like $101,000, and the amount of folks that are considered poor, I think, are 6.9%. So there's the other percentage that Mr. Stroud was speaking of, and we want all of our citizens to have health care and opportunities, not just folks that you were talking about. I think that was Mr. Stroud's point, is that we're looking for a big picture, and Mr. Smolnik will provide you all the data that you ever want or need or even care about, and we'll take care of that. And we thank you for coming, and we look forward to our new hospital. Thank you.
Thank you for your time.
Thank you.
Thank you.
All righty. Anybody need 5 minutes? All right, we're going to be in 5-minute recess. Ready? That was some good conversation, a little bit longer than we expected. We do have a lot of things on the agenda. So next thing we have tourism sponsors grant, Ms. Southall. I'm sure you have a very quick, since this is an action item.
Good evening, members of the board. I just made the changes to the application that we discussed at the last meeting, and this has been reviewed by Mr. Stewart. Mr. Jones, if you want to scroll down to the paragraph that's inset, that's the paragraph that changed. Any tourism initiatives that are well established, more than 5 years of operations, are not eligible for the grant program unless requesting funds to expand their initiative. However, well-established initiatives may submit an existing sponsorship package with this application for consideration. If packages are submitted after the grant program deadline for the given fiscal year, staff has the discretion to review the package and determine whether the sponsorship aligns with the county tourism's strategy. If selected, sponsorship will be awarded based on allowable funds for the remainder of the fiscal year. Upon sponsorship, the county enters an agreement with the tourism initiative selected that the benefits of the tier outlined in the package will be satisfactorily met. Proof that benefits were received is required to be considered for future sponsorship. And we just included an additional application that shortens from the existing grant application. So that's what this application link is. And there's that added tourism sponsorship package support request link. It's just a shortened version of the grant because we don't need all the same information. We just need the basic information about the event and the package.
Already? Is there any questions?
No, sir. I'd like to make a motion.
Go ahead, sir.
I'd like to make a motion to approve the updated tourism sponsorship grant program.
Second.
Properly second. Is there any discussion? Seeing none, all those in favor?
Aye.
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 Chair votes aye. Thank you, Ms. Southall.
Thank you.
Already, 10:05. New King George County Courthouse change orders. Mr. Smollett, you want to start the ball?
Yes, thank you, Mr. Chairman, members of the board. So, as county administrator, there's been some staff changes. I am now the point person for the courthouse project from here until the day that we open. So I just want to lead off with a couple things. I know I've requested Branch and Mosley to be here to answer specific questions from the board, but a couple things that I just wanted to kind of just get the discussion kicked off with. So we had a meeting on, it was last Thursday, I think it was myself and 9 of my staff members over there at the courthouse, going over these specific ones. And just a couple things that I wanted to mention, and I know there's further discussion from the board. Maybe the Branch can expand on some of these. We talk about the CT cabinet. It's my understanding that we now have possession of that. How does that impact the timeline with the switch? That's one thing we can talk about. Another thing, I know there's one specific change order that I very clearly mentioned was the monitor heights. There were 4 monitors. One of them was an error in measuring where the jury was, and I said, this will come up at the board meeting. So here we are talking about that. That was an error in measuring the height of the wall. Yet we are getting billed for that. And then, if it's my understanding, and then I'll look to some of my staff who were there also, but I believe the majority of these change orders, the work has already been done. So I guess, just maybe some clarification questions I'm getting from my board were, who approved these change orders prior to the work getting done? So I'm going to start with there, and I'll kind of turn it over to the board and look to the group to help answer some of these questions and any questions that the board may have.
So who approved, I guess the question from Mr. Smolnick, and probably all of us, is who approved these change orders?
So our previous person that was approving change orders is Travis Quisenberry, right? He was our the owner's rep that was on the project from the start of the project till now, till a couple months ago, and we continued to send him. We were never notified there was a change in this. These aren't change orders. These were, so this is a CMAR. This is a construction manager at risk project, right? It's under the contract. So there's a contingency within the project. So these are not change orders to the project. They were change orders that were removed from the project contingency. So all we required from the owner's rep is an approval that these were. So the contingency is set up on a project like this to deal with gaps between scope and gaps between design and scope, and this is why we carry these items. Yes.
I'm sorry, sir. I need to have you introduce yourself for the public.
Sorry about that. I'm Todd Demetrio with Branch Builds. I'm the Director of Operations. Thank you. So this project is set up to have an internal contingency to pay for gaps between a scope between a drywaller and a framer or whatever it may be. There are small things that we are not going to come to the owner for, so we set aside a contingency that was approved within the project. So what we have done and always have done on this project is come to the owner with, are you approving us that this is to take money out of this fund because we have to. This is a wide open book. We show you everything that happens on the project. So all we're doing is getting confirmation that we're moving funds within the project to this project to take care of these gaps. And this was always part of the project. We don't come to you for, I think to date on this project, and that was a decision made by the owner's rep at the time, was $56,000 in a change order, and that was because you wanted to pay for it, not out of contingencies, but the decision was made by Travis and the previous councilman that this was going to be a change order outside of the contract, and it was 56,000, I believe.
What? I don't.
We had
What are you
one
talking
change
about?
order on the project.
Oh, yeah. That's the only change order.
That, so when we signed this contract with the county, there was a discussion about change orders, and we specifically said if there is something that is outside of our scope of work that is added to the project, that would have to be a change order. Now, the internal discrepancies or changes, those things are carried by the contingency, but if there was an added scope by the county, there would have to be a change order, and this was added scope. This was something you asked for after the fact, and the county felt at the time that this was a change order that they brought to the board, and you guys approved that change order. That was the only change order we've had on this project to date.
Well, these that are in front of us, these 9, that somehow you already got the money for. So a lot of them I see as mistakes. So are they mistake orders? So the monitor for the TV, I thought, so in the plans it calls for a certain spot, and I'm sure that the architect looked at all the Supreme Court requirements for this, and so why would we want to pay for that?
Sir, so these are not mistakes. In a regular construction project, there are going to be discrepancies. There are going to be issues between scopes, scope gaps, and that's why you chose to do this procedures policy, the CMA, right? If it wasn't, every single one of these change orders that went out to the job would have been a change order in the project, which the county had agreed not to have that. That's why they put this out as a CMA. So we carried a contingency within the project to do this. These are not mistakes. These are gaps. Nothing can be fully finalized, right? There are gaps. It's not a mistake. This was why there was a contingency put in the project. Right?
So when you repair and replace vinyl tile, so you're repairing and replace something that's supposed to be new. Is that correct?
That was your contractor that damaged this.
What do you mean our contractor?
You guys had a contractor that you paid directly that damaged some tile.
Mr. Smolin?
I believe that is correct. We had, there was a separate, from my understanding, there's the rolling files that are there. And they came in, I guess, when they were installing the track, and they had damaged the floor. So this was one very specific thing that this particular, and, I guess, are these change orders or not? Because, they're listed as change orders. We keep talking about change orders, but for this specific one for 30, I forget the dollar amount, 3,300, that, to my understanding, that was a specific direct from our contractor outside of Branch Builds.
But we need to go after that contractor to reimburse our funds.
That's correct.
So tell me about the bullnose on the judge's thing for $2,800. So so you're telling me that
This one
bullnose cost $2,800 for
is
the judge's thing?
is Abe Sankari. I'm the project manager on the job. So the nosing for the judges, there's no detail, but we took care of it. We're gonna remove it from this change order. So we already talked about that separately. For relocating the TVs, we had them on the drawings, but the staff, the courthouse staff, requested to change them, to change the location, or make them higher, and that's why we came up with this change. And we proceeded with this change. We want to open the courthouse, right? And
So how many were there?
We're like 4. We changed the height.
Okay. Did
And
you go
another
down or up?
Up, higher,
How much up did you go?
about 3 foot.
Okay, and how much did that cost us?
it's gonna cost you a lot because we have sound panels.
I just asked the question, sir.
Yeah,
How much does it cost?
it's in the change order. I don't know exactly the
Give
number.
me the number.
Yeah, not on me, with me, but the biggest cost is, I will tell you, is the sound panels. We had sound panels on the sides, and that's why it's cost a lot. We have in-house carpenters which spent about 2 weeks to move those and do the blocking. It cost us about 11,000, and sound panels would cost about 18,000. That's the
Were the
big.
sound panels above the TV or below the TV?
No, it's behind them.
Behind them. And they're behind the TV. All the sound panels are behind them.
They're behind the wall. Yeah, it's behind the TV. Yeah, so we had to cut them.
I understand how to do this work.
Okay.
So that's why I'm asking you why so much money. Because if I were to charge somebody that kind of money to do that, they'd call it fraud.
Sure. The sound panels are a specialty item. They had to be cut because they were put in place for the location that they were supposed to be at. To move those up, we have to order all new panels to replace them because now there's going to be a hole in the sound panels when the TV moves up. So they have to be replaced.
Okay, so I'm going to pass it on to the next one because I'm already too fired up with you fellas.
I have a question. Yes, sir. So, and the question may not be to you, it would be to our contracts reps. If somebody told you to change the position of the monitors, and this person, whoever this person is, was authorized to change the contract, or did you just, I mean, why did you make a monetary change without having contracts or somebody approve it? And you're going to say, well, it goes back to this type of a contract. Okay. But now you're coming to us to ask for the money. So if you're exceeding the amount of money that was awarded.
So we're going to take a little bit of we're going to go, I need to give you a little bit of history on what happened on this project and why that fund is not enough. Several months, it was 9 months ago, or the county has a budget within that you guys agreed to, and that you told us set a budget for a AV access control system in the project, and you exceeded that by $180,000.
Okay, let's pause real quick. You said we exceeded it by $180,000. I'm curious how we do that, because like if I'm using my credit card and my credit card has a limit, and your limit, there was a limit, and you exceeded that. I can't exceed my credit card without making a change. So how did you exceed it by $180,000 without coming back to us and saying?
We did.
Oh, you did?
Yes.
And we approved the $180,000 increase to that?
That was before I got here. I know you gave me some history on that. Can you do rough time frame?
Let's get Ms. Bender because she was on the committee, and Sheriff Giles, you were on the committee. If you want to throw anything in, go ahead, Ms. Bender.
Yeah, I've been waiting because I actually went back and looked at all the minutes from July all the way back. And I've looked here, I'm going to give an example on 5/11/23 at meeting number, I think it's 15. You mentioned after new business 1514, after the meeting, AV meeting was conducted at the sheriff's conference room. Architect will send drawings to state Supreme Court and look to how the amount got set and it is the right. I hand wrote this real quick. He did the allowance after the meeting, drawing and sent an owner spoke to Tony Bell. So why I'm bringing this up is I know our staff, you have to consult and they can help me out with some of this information, is that, and they're not really our staff, they're the Commonwealth's attorney and Sheriff Giles, but
Clerk of the Circuit Court.
The clerk of the Circuit Court. But there are standards. There are state standards. And I know they've reviewed, and I think the Supreme Court and Ms. Gunsman could probably help a little bit more on some of this information that I'm regurgitating. But there was a problem with some of the heights, and it has to do to code. And that should have been fixed at the beginning. Just going back to the locks, that really burns me because I was in that committee on the design, and we spent a whole meeting talking about the proper locks. And now we're finding out that it wasn't done properly. And this goes way back to the middle school project, and that I was one of the people who pushed and supported construction manager at risk. So one of my direct questions is this money, is it coming out of the money that the county would have saved and got back, or your profit from the project? Where is this money coming out of if this contingency change order, whatever you want to call it? Is that what the issue is? It's which pot of kitty it comes out of?
No. So I got to answer the first question first, and then I'll get to yours if I can, please, because I didn't get a chance to explain fully. So we did get approval for the $180,000.
From whom?
We have a signed change order from Travis Quisenberry in the previous. This was internal. It took it from our general conditions, and it took it from other budgets. So a contingency is set up for the whole project. The project was supposed to be split, the contingency at 50-50 or 25-75. So whatever savings we could have on the project, the county would receive 75% of that back, and Branch would receive 25% of that back. But because this overrun was in the AV access control, we had to, and we did, we took our general conditions and put that into the kitty to create enough money for the county to have this access control, what they requested, above and beyond what we had in our contract. And we made that change order, and we included it into a change order that was approved by the county and approved by the board.
So this shenanigans is the same thing that happened on the middle school.
No, it's not.
It's the same thing in with a different light and a different color. So Mr. Bell remembers the meeting over there at the sheriff's office, and I don't know if either one of you were there.
I was there.
And I remember what I said, not going to pay for any change orders, right?
You asked for something above and beyond the scope of work.
No, I didn't.
You did.
We didn't. So the bottom line is that we are extremely upset about this. And that's why we brought the blueprints here. For one reason is because Ms. Bender and Sheriff Giles, Ms. Gussman, were you on that committee? And were you, Ms. Manning? That was when Vic was on the committee, right? Okay. And we looked over these prints. We can't put them online. We can't put them up because of security reasons. But we looked and see that they were on there, and so they were approved set of drawings. So these things, this is not unfamiliar to King George about finishing a project up. Let's see how much money we can get out of that fund, and that's where we're at, and that's what I'm telling you. So if we've paid you, I want my money back.
Well, I'm sorry you feel that way, but that's not what happened. I just explained the situation that happened, and it was that you guys, the county has asked for something that was outside of our contract. And Tony, I think you could probably explain more about what was included in the original drawings. I'm not the designer of record, but I know what we agreed to and what we have in the contract. And what we have in the contract is what we've provided you. And there was an ask in the middle of the project for additional monies that were not included in the project, and we, Branch Builds, came up with a solution to keep this inside of the contract and not have to go to the board for a change order, because we knew what kind of an issue that was. And we took our funds, which we have been paying for this job since April. We've taken all of our people off the job. They're still there working because we are short on general conditions, and we never came back to the county to ask for any extra funds. We've done that on our own because we understand what's going on here, but there was an ask by the county for additional things to the contract that we don't have in our drawings. They were never included in the drawings that we bid. They were never included. Again, Tony would have to speak to the design of this, and I think he can. But I'm not here to try and pick a fight with the county. We enjoy working with you. We've done a lot of work with the county. And we've done everything that we were asked. There is an ask above and beyond the contract. We came up with a solution inside of the contract to be able to provide you with the extra AV that was not included, that the county had requested and outside of our contract. We came up with a solution for that, and that's what's making our funds short. That's why we're coming to the board tonight to ask for these change orders, because we don't have the money within the contract that we would have if this change had not occurred.
Okay, Mr. Davis?
Yes, sir. So thank you, guys. So I just want to be clear on this, because I wasn't here when the board voted to build this and all that. So the courtroom monitor height. So if I look at That should be in the blueprints. So in the blueprints, the measurements that are in there, is that the height that that you guys originally hung them at?
Yes.
So you met the standard of what's in there, and then that wasn't right. In other words, that wasn't the way it was supposed to be by the Supreme Court or whoever what they
So
meant to be.
Can I, if Sheriff or Ms. Gusman want to give us some information, because they were on the committee, so I'd like to get some clarity to this. If you don't mind, if you don't want to, you don't have to.
A couple weeks back, maybe it was even in August. I was called over along with the clerk of the court and Lieutenant Govan, along with Ms. Carpenter, because they observed that the monitors were too low in the courtrooms. They were eye level. We advised Ms. Carpenter that it wasn't acceptable the way they were. Through the conversation, we did some measurements, and Ms. Carpenter made a comment to the reference to that the drawings say they should be 7 feet. And they were nowhere near 7 feet. The bottom of the monitor was probably at 4 foot or so. So when we did the measurements and we told them where we would like to have them be, she agreed that that was part of what was in the writing, and it was a mistake. It was the information I received. So that's as much light as I can put on the monitors for inside the courtroom. Now, the other monitors.
And I was actually going to address specifically the one monitor that we have that's going to be in the circuit courtroom. So that's going to be room 230 on your blueprints. And it's specifically, this was what they sent us for the change order. And what you can clearly see is the one that they had to change is behind the jury box. And it actually was so low that it would have hit the chairs that the jury members were sitting on. The issue became, we were able to figure out in the meeting that the sheriff has just described, is that the height was from, sorry, I walk away from the mic, from the floor. You have the second row of jury chairs are on a platform. So they measured it from the floor, not from the platform. And yes, that was absolutely conceded that it was not the right height. It wasn't to the specifications. It wasn't going to work. The other 3 monitors that we are talking about, there actually happens to be 2 different monitors in the circuit courtroom. So you have the one directly behind the jury and you have the one across. The one across in the circuit courtroom, one in the general district courtroom, one in the juvenile domestic relations courtroom. All 3 of those were so low to the ground, as you folks can clearly see, I'm short. And if I can hit my head on a TV, it's clearly not high enough. And if we want to look at the other flat panels, what they have said is that it's in the plans that these were supposed to be in attorney conference rooms. That was never the agreement. I don't know what's in the plans. I'm not going to say what's in a blueprint. I don't pretend that I can read them. But I can tell you in each and every meeting, we never would have agreed to put monitors into attorney conference rooms. The reason why I say that is that those conference rooms are for defense attorneys coming to meet with their clients. Show them the evidence, maybe. Maybe they should have done that before court. That's neither here nor there. We're not responsible for providing that. We needed those in 2 different places. One being the 2 waiting rooms for our witnesses. As everybody knows, you can't bring anything into a courthouse anymore. So those are TVs that we have to keep folks comfortable and entertained while they're waiting. That's something we already have in the old moldy courthouse. And then number 2, what we already have is that all of the attorneys have the monitors. And we need those in our offices so we can practice how to present the evidence to the jury in using the computer systems. And so we took them, yes, we took them out of rooms that they never should have been in and asked them to move them to the rooms that they are already or always should have been entered into. So that's the issue with the 2 different lines of your monitors.
So what I've just heard is a sworn Commonwealth attorney, a sworn sheriff, just telling me that your people, that they were wrong. But now you come up here, I don't, that's another part of the shenanigans I'm talking about. So somebody's not telling the truth, and I believe these 2 over here.
I'm Samita Carpenter, the Mosley Architects representative on CA. Everything that was installed was per the drawings. What I mentioned was that on the electrical plans, we usually have the monitors at the electrical outlet, single outlet at 7'6". But these were based on the AV drawings, which was which was an allowance amount, and they installed it minus that one deficit of 7 inches. They installed it per the drawings. What happened is we were going to raise that back of the jury up, and the sheriff said, okay, well, both of the monitors in that one courtroom should be at the same height. And then we went through all this, and I said, how high? All the way almost close to the ceiling. We made sure that we clear all kinds of fire alarm devices that are there so it won't bump into it. And so it was established you can go 1 foot down below the ceiling trim.
This is the first courthouse you ever?
No,
Okay.
I actually did.
So courthouses have jury boxes, jury platforms, right?
Yeah.
That's not a surprise, right?
Well,
is the first time y'all have ever built a courthouse? Yes? Your first courthouse? Okay. Well, maybe you had some learning curves from this.
So
you're just telling me the same thing that's been talked to about these guys. So the bottom line is we don't want to pay for these items. We want our money back. Well, I can't say that. I have to ask the whole board. What y'all's feelings on this matter?
Well, I think what I heard is that the heights were put in the drawings incorrectly. The heights in the drawings were put incorrectly. In other words, no. So the height in the drawings says it should be 1 foot from the ceiling.
So wrong drawings were used. They used the AV drawings instead of the engineering drawings.
Okay. So the plans are wrong. If the plans are wrong or the plans are right, if they were installed according to the plans and they're too low, then the plans are wrong.
So ma'am, Mr. Bell's up there. Introduce yourself, Mr. Bell, if you're going to speak. All right,
I just want to say that it happens at every project is when the finished product is getting up there, the end users and whoever's involved in using that space come out and say, oh, that's not what I expected, even though they've looked at the drawings. So, I mean, I don't blame them. Looking at the drawings is one thing and looking at the real life thing is another, but they had installed it per the drawings.
So you work for the architect?
I'm the CA, Construction Contract Administrator.
Who do you work for?
Mosley Architects.
Okay. So this is not your first courthouse, right?
No.
Okay. So this, by review of the amount of money that we spent, just the drawings could be correct. It's the same thing in the middle school where there was a janitor's closet with no door. The only door was an outside door, so they had to take their equipment all the way around the outside to come in. And you all scratched and bit for that money for a mistake that was made, along with pipes that were going through. They say in the old middle school where they didn't see them. Well, that's your responsibility to look at them because that's what you're getting paid for. So if they're not going to pay, I guess you all are going to pay. But we're not going to pay.
So, ma'am, what was your guys, way back, what did you guys estimate the cost of the courthouse to be?
It's whatever that GMP was
About $28 million then.
close to, I think 27
So,
something.
so you guys usually put at least a 5% markup on top of that, which is about $1.4 million fee, which that's on top of the drawings and stuff like that. So you guys have got about a $1.4 million fee, and which you got paid to make the mistake, or you produced a plan that was a bad plan. You produced a plan that had the TVs too low. So it sounds like to me that those guys installed them according to your plan, but you guys had a bad plan.
Well, sir, I can only go by what's in the drawings. So
Right,
I'll
but
let
you guys are architects. You guys are responsible for the drawings, or you hired those guys. And whenever you say that, okay, but the user shows up and says, we want it this way, we want it that way, that's why they're not architects. You guys are the ones that are the professionals at designing it. You do the wire diagrams, you do all these plans because that's what you're getting paid to do.
I think the intent of those monitors is that you could actually handle them and move them to face, because they're on a mount that does that. And if it's up higher, you're not going to be necessarily able to do that easily. So the placement of that was so that it can be handled, moved, so for the viewing of the people in the court.
Okay, so what he just said and you just said, you just contradicted yourself a few minutes earlier. So you said they were put down low so they could move them around. But then you said that you've designed courthouses and you understand the jury, they need to see the monitors. I mean, the people need to see the monitors. Anyhow, what does the board want to do with this stuff? Because we're not getting anywhere here.
I surely don't want to pay for it. I don't want our people to pay again for somebody's mistake. That's my opinion.
Ms. Bender?
Well, I have a question because I know this is vital for the operation of the courthouses, these card readers. And why I brought it up earlier, and you know, Mr. Bell, I was the biggest cheerleader for construction manager at risk, thinking it was a really, really good idea and a good path forward so we didn't repeat the middle school project. But I remember every one of those design meetings we were in, and I know Ms. Gustman was in them, Sheriff Giles was in them, Lieutenant Govan was in them. And none of us ever remember that we said, hey, we want keys for all the doors. We remember swipe cards. There was even, and Sheriff Giles reminded me today, we even talked about having wristbands to be able to open the doors with a swipe card. So where did we get keys and the cards went away? And because that is vital, because I've heard from the courthouse staff and Ms. Gunsman and Sheriff Giles that those are vital for that courthouse to open, for their safety and the safety of the people they serve, is to have swipe cards and not keys on every door. So where did that disconnect happen? Why did they not be part of it? Because I remember we spent a whole meeting on it.
My name is Tony Bell. I'm with Mosley Architects. I'll address your question first, Supervisor Bender. With regard to the doors, we agreed at the meeting that we could not afford to put card readers on every door. Card readers cost far more than a keyed lock cylinder. The county had a finite budget. We were balancing needs and budget from the very beginning. As you may recall, we started out with a need of 65,000 square feet. The courthouse is 50. Why? Because we couldn't afford to build 65,000 square feet. When we went through the different door configurations, we put card readers throughout the courthouse. Are they on every door? No. Why? We couldn't afford to put card readers on every door. We put them strategically on doors that were of high use, that needed to separate the public areas of the building, that's where the citizens would be, from the staff areas of the building. I see with this change order, we want to add 13 additional card readers at a cost of $71,000. That's above and beyond what's shown in the documents, what we all agreed to during the development of the design. Now, if the county's opinion is the design is wrong or the design was excluded of some of the details we wanted, we're going to have a difference of opinion. We collectively came to arrive at that design, okay? And whether you call that design bad or missing or in error, again, it's a individual opinion.
So
We all collectively came to that conclusion.
who's we? The users?
We the partners, Mosley Architects in King George County, and within King George County, I include the court stakeholders, the constitutional officers of Commonwealth's attorney, sheriff, and all of the sheriff's staff, the judges, the clerks, JNDR-CSU, and all of the county staff who participated in the process. Everyone had an opportunity to look at the drawings, to review them, to ask questions. We put them out for bid, okay, through the CMAR process with branch builds. We had budget issues at that point, as you may recall. And there was give and take even at that level of making sure that we included all of the highest priority needs, but still staying within the county's budget. Ms. Bender, I applaud you for selecting the CMAR process due to identified deficiencies that the county had with the low bid process. And the reason you go with the CMAR process is you know from day one who your contractor is going to be. You've established a relationship with them. You trust them. And together you walk through the construction process delivering on what was agreed upon. And I will say the construction value of 27, I'm gonna read it off to you, okay? $27,797,243. And to date, there's been one change order above and beyond that amount of $56,000, which was granted an improvement above and beyond what was shown in those documents. We come before you tonight with 9 different items, okay? And I don't want to talk about the middle school, okay? The middle school's done. Okay, there's no need to go back and revisit the middle school. I want to focus on these 9 items and make a determination of what the county wants to do. There's 2 items that are not Mosley Architects' fault. It's not Branch Build's fault. It was brought to our attention with a vendor that the county hired that additional funds were needed to provide elevator operation and additional funds were needed to repair tiles, which that contractor damaged. Is it a big deal? No. Is it an inconvenience? Yes. So we can all sit here and say, yeah, it's unfortunate, but the fact of the matter is funds were expended to compensate for this vendor being on the project. Again, we can go through each one. Mr. Collins, happy to do so. There's one that has not been done, okay?
That's the first one, is that correct?
That's the first one.
So that one, Sheriff Giles, Ms. Gusman, Ms. Bender, you all were at the meetings, and didn't you all decide where you needed these readers? Is that true? Right? That's 1, 2, 3. So, but you're telling me that somebody else decided other than the people. Who's the other person?
What I'm telling you, Mr. Collins, is what's in the drawings, everyone agreed to, okay? Now, it's going to be a he said, she said, and I get that.
If you ask me how many courthouses I've done, it's a lot. This is not about designing courthouses. This is about process, okay?
Well, so Mr. Bell,
Yes, sir.
so, you and I have had some differences of opinion over time, and you do remember the meeting with the old board that myself and Ms. Bender was on.
Yes,
And
sir.
and I was very straightforward to you. This number is it. And you said, absolutely, I get you. I understand what you said, Mr. Collins. And so it's not a fact, is it? And so you have these three people again I keep pointing to, and so this work, this add card readers, 13 doors need to be done. And we will, so there's already been three people say that we don't want to pay for this. David, what's yours?
My opinion is I don't want to pay for things that aren't my fault. Now, if there's things, the courtroom monitor heights, to take responsibility for that means that you get me, if I was at 100 and you made me lose 100, responsibility means you get me back. Taking blame means you don't do anything about it. So someone has to take responsibility. And I just don't understand why the responsibility of the monitors falls on us. I mean, you yourself said you've built tons of courthouses. You know that the monitors are going behind the juror box. So anybody should know that it's going to be measured from the juror box up and where it needs to be. But that change is coming back to me. It's going to be my fault. And so I'm the one taking responsibility for something that I did not do and the people of King George did not do. At some point in time, there has to be a little bit of responsibility. If there's things on here, if we had people agree to how many doors we needed to have electric card readers on, and then really what we needed by the Supreme Court or specs is that we actually we underdid that what we negotiated with you on, and we need and they're saying that we actually need more. If that's the case, then that's something that we should do. But there's some things in here, and you have to understand that I'm not going to take responsibility for every single thing. There's some things on here that maybe aren't your fault. But I think it's kind of pinpointing what those things are. That's exactly how I feel about it. I'm not saying there's probably some items on here, like if that's what the card readers are about, if we decided that we needed, 50 card readers, but by, standards of Virginia, that we actually needed to have 60 card readers, and we made that error from the beginning by undercutting it, then that's on us, is how I feel about it. But that's something that needs to be fixed.
Ms. Bender, what's your MO?
So the card readers, there's also a disconnect because there are some employees that are no longer with us that we cannot ask that maybe made some decisions. And I know myself, in my role being appointed to the committee, I was dropped off after the design phase. So in any of these meetings going back to 2022 for meeting one, I was not included. And there were different people that came in and out that are no longer with us, and some people that are here with us. But I know they need the card readers, and it's vital so I don't know if we're going to sit here and we're going to argue about this, or we're going to make sure that they get what they need for the safety of the staff and for the citizens. I don't like paying for it, because Mr. Bell even knows that I hate change orders, but I don't know if we can pinpoint where the disconnect was or what happened. I'm very disappointed, but I know they need it. So I'm putting that out there. And for the elevator, I understand it now, but I don't like it because I wish I could be paid as much just to push a button on an elevator. That's kind of ridiculous that that's what you're getting money for. It's ridiculous. But if that is something that is required by law, we're gonna have to pay for it because we do have a lot of furniture that had to move up and down. I don't like it though. So that's my comment.
Alrighty. So, three of us don't want to pay for these change orders, and we do want the card readers on the 13 doors.
Mr. Chair.
And I was going to turn it over to Mr. Stewart.
I'd like to be recognized, please. I have a question.
Go ahead, sir.
My question is concerning what brand card readers were installed. Okay, my next question is, who is authorized to program those? Is somebody in the county staff authorized to program those?
So the answer to the question for this courthouse here is to have someone that can program them. But I don't know the answer to that question.
Well, I mean, because, I mean, we're paying till for forever for somebody to come back and reprogram these things. And we shouldn't be paying for that.
Sheriff?
That falls on the IT department. It's like the locks that we have at the sheriff's office right now, they're swipe. My IT specialist programs them, who has the permissions and who doesn't. And it would be the same thing with the courthouse. Is I don't know if it would fall under Chris Steins or myself as far as who programs them for people's permissions to what doors they can get in and cannot get
Okay, because my question is, the reason I was asking that is because if you decide to have these installed, then you don't necessarily have to pay the $71,000 to do it. We could buy them. We could put out another solicitation and have somebody come in and provide these and install them for less money.
So can we get
Can I address that real quick, Mr. Chair?
Yes, sir. Go ahead.
The ones that are already been programmed into there, if it's a different make, then we have to use different software to be able to program all that. It's more ideal to be one system.
Right. That's why I was asking the brand. I mean, typically your contractor, they went out and found, we told them in our contract what brand and what model that we wanted to use, then they just selected it and provided it as a part of the contract. And they're not necessarily the only ones that can buy it. Now they may have, or whoever they used have a dealer agreement. They have an agreement with them that allows them to purchase from the OEM, from them, or from the distributor, that they can buy from them. But that doesn't mean they're the only one that can. So other companies, I use them. We install them. I mean, we do that ourselves. So I'm just saying they're not the only ones. So before they can bid on the contract as well, but if this contract allows it, since it's not within scope, and what we're being told it's not within scope, then there's nothing keeping us from just bidding it out and seeing if we can get a better deal. That's all.
So, Mr. Stewart, can you give us any words of wisdom?
Mr. Chair, I apologize, but IT hasn't come.
Okay. Anybody else in the audience have anything on this?
I'm sorry for prolonging this. There is actually a vendor that we have, Dormicaba, and they have programmed all of the security systems here in the county. So they were always going to be someone who would have the overall OEM, as you said. And we use On Guard Linnell is the brand name. And they're the main person in this area. So when people need things, they usually order the hardware from them. But we have our people that we have used, and the sheriff knows Mike Hilton and John Johnson, and they have the rights with the On Guard Linnell people, and then we have the trust with them who have done our systems throughout the county to work with whoever the vendor is to be able to set up all these doors and to ask for any help that they might need from the On Guard Linnell people.
So if that's the case, if they're the ones who did it, then I would expect Branch Bills probably, based on this, they have a pass-through or a markup, 5%, plus there was a markup that was put on there by Mosley. So that alone is an additional 10% compared to whatever they were charging.
Mr. Stroud, let me correct you on that. There is no markup from Mosley on any of the items that are on this list.
The original contract that you guys marked up, the original one. Correct?
Excuse me?
The original. You guys did the original architectural plan for this?
We did the drawings, okay? And we have a contract with the county for the drawings and all the services associated therein.
And this, so
Okay.
this services, these aren't part of the services.
No, sir. None of these change orders are part of Mosley Architect Services. This is all dealing with the contract between King George County and Branch Builds. The reason we're here is because they're based on the deliverables, the exhibits, the documents that we created. Does that make sense? Do you understand the relationship with that?
Mr. Bell,
Yes, sir.
I understand the relationship. I also understand that in everything I've seen that came from Mosley, there was considerable markup on top of that. So maybe you didn't mark up this $71,000. Maybe it's only the Branch Build 5% markup, but you marked up the overall. This right here, maybe there's not. Maybe you don't have 5% on top of this.
We don't put markup on anything. Even our consultants, we don't mark up our cost of services. What you're seeing, I think, Mr. Stroud, I'm just going to hypothesize here. What you might have seen is an exhibit from Branch Builds, which had markup on it. It may have had a cover sheet from Mosley Architects because it was a change order or some other kind of documentation. But we don't put anything on any of the construction cost. If let me be clear. If there's a change to the construction cost, Mosley Architects doesn't get any more compensation for that whatsoever. To Ms. Bender's point, Mosley Architects does not like change orders. We wish the drawings were perfect. We're not perfect. We
Okay.
will make mistakes.
All
None
right.
of these items, as has been pointed out, none of these items on the list tonight,
Mr. Bell?
however, are mistakes. Yes, sir.
Mr. Bell,
Mr. Collins.
thank you. Back to Richard Stewart.
Mr. Chairman, I think at this point, it may be more productive if the board is okay with allowing Mr. Smolnik and me to speak with Branch and Mosley and Commonwealth Attorneys, the sheriff, and the other interested parties, and let's see if we can try to bring back a resolution to the board at the next meeting. If not, I will present you all with your options for other courses of action.
I have one, I know, what is the date right now on the opening of the courthouse? I'm bringing up the card readers again because I know that's important to be done now.
Right now, we're installing the switchgear. They will be starting that next week, so we have a couple inspections. And then we'll be installing the switchgear. It's a 5-day turnaround period to get that done. And at that point, contractually, we would be able to turn it over to you. We'll have our technicians. We have a couple of inspections that'll have to occur after that. I think we have ourselves.
Yeah, we have this week and next week we're doing final inspections, and that's including fire alarm, sprinkler, electrical, mechanical.
Who's doing the punch out?
We're doing the punch out as well.
Who's doing the punch out?
We're doing it and ourselves.
So who's our walkthrough person?
Branch Builds doing.
You're our walkthrough?
Oh, if you wanna, you're welcome. You're welcome. Come over. Absolutely.
Okay, so Mr. Smolnik's our walkthrough. Okay.
Yeah.
I just want to make sure that
Thursday
we're
of last week,
represented.
we were notified that Mr. Smolnik
How about
was point of contact.
how about anybody on the anybody else, Mr. Smolnik, like the sheriff and the Commonwealth Attorney? On a walkthrough, I think that would be an important.
I will have a team of individuals assisting me with a walkthrough. Yes.
Okay, and so at this point, these items, the second one down, do you all agree to turn over to Mr. Stewart and Mr. Smolnik for them to talk to these parties to see where, if we can work something out or if we have to go to court?
Real quick. Sure. Can I address real quick?
No, we're trying to get to the end of this.
I know you are, and I am too. I am
Haven't
too.
you taken enough lashings for the day?
No, I haven't.
Okay, go ahead.
I want to address the point I tried to make to you guys earlier. the funds that were carried in this project were plenty to finish the project. There were some questions, there were some things that were asked for by the county that we had approval to do that took funds out of this. Without those, and I did not mention them all.
All right, sir.
Hold on.
No,
There
no,
was
you
a change
don't.
order.
No, whoa,
Sir,
you
sir,
don't hold on me,
sir.
okay? You need to stop talking or you'll be escorted out. So we're getting ready to close this thing up, and we don't need to go over it again. We've already decided what we're going to do, okay? So please don't talk anymore, okay? All right, so we're going to remand that to them. Everybody agree?
Yes, sir.
You're talking about 54 to 60 or 53 also?
54 to 60, we're going to go back to 53.
Okay, that's fine.
Yes, Mr. We can go back to 53. I mean, card readers themselves, I mean, you're looking at probably around $3,800 for the actual card readers themselves. So I'm not sure what's entailed in the 71,000, but for that many card readers, I mean, you're looking at probably somewhere roughly between 300, maybe overpriced 500 for a card reader. So I'm not sure where the 71,000 is coming from. So maybe it's electrical or whatever, but it seems to be a little bit strong.
So how do we want to handle the card readers? Collins, you have any?
I would like to remand the whole thing over to Mr. Stewart and Mr. Smolnick, but I would like to ask, is there provision here that this can come back somewhat of an a la carte? I mean, from taking away the big ticket items at the top, the stuff below that, some of it I either don't understand what we've got, or some of it I recognize that it's somebody else's fault. We can go after that contractor, or it was a services rendered, or the two bottom things. I just don't care. It's just small change. I really don't care. But those top three items, it's 120 grand. I care a lot about that.
So that's so far we've remanded those other ones to them. The card reader do we want to remand to them?
I have concerns because of the opening of the courthouse to make sure it's done and the courthouse doesn't open with keys. And so that's where my concern is, to make sure that this is done correctly for the staff that is using this building. So if we need to consult, Sheriff Giles about and Kerry Gusman and Ms. Mattingly about it, that's what I want to hear, because I don't like paying for it either, but I want to make sure the right things are in the building, because we cannot address for things from staff that are not here anymore that might have made decisions that we don't know about. So that's where I'm coming from.
There's plenty of people that are here. You got 2 constitutional officers and you. And if you can't trust them, I don't know who you can trust. Whether some people are gone, there must be a reason for that. But anyhow, we're trying to get to this one issue solved.
That's what I was talking about, 53, because that is important to them. And I'm sure Ms. Gunsman has told me quite a bit. It's very important. Every band practice.
Yes, I called her and asked her, and she told me it was very important. But so we had to get from where we're at here to get those card readers in, and how we're going to get there.
Sure, I'm quite fine with the county attorney and Mr. Smolnick discussing all the matters with them. I'm fine with that. I'm not fine with paying an exorbitant amount of money rather than using keys until we can get card readers put in. It doesn't mean for eternity using keys. Maybe it's a week, maybe it's 2 weeks. I don't know. Maybe even not at all. But we need to have the opportunity to look at it rather than pay $71,000.
I hear you, but I also want to. So I don't know where these card readers are. Are they going to be where there's issues where a deputy has an inmate and has to go to a key to get through a door?
I can't speak to all of those. What I did want to mention, number one, we were talking 13 doors. 3 of those doors are double-sided. I believe those are all controlled by the sheriff's office, and that has security issues there. The one that I was going to bring up is one of the ones in my office is for the VCIN terminal, and that's the Virginia Criminal Information Network. And former Trooper Collins understands what I'm talking about, in that the state police won't let me open that up with just a key. It's got to be a swipe card. Can we get those criminal histories run by the sheriff's office and somebody's running them back and forth between the sheriff's office and the courthouse. Could we do that for a week? Sure, we could do that for a week. But the problem is going to be the safety of doors, specifically one of them in Ms. Mattingly's office, the circuit court clerk. It's right next to where she keeps the money, where they're receipting things. And there is a door that is completely open to the public that is gonna need those. And I know that was a great concern. And so we did have a brief discussion. How much could we do? How much would the sheriff's office need additional manpower? And would they need people actually standing there during the normal business day? So I don't think that it's going to be worth it in the end that we could open with the amount of additional manpower that would be needed to cover those safety issues. I don't know, but I don't think that's going to work in the end. And the other issue that we're going to face is if, and this is something that you folks know much more, what your schedule is of approving things. If we go with a different vendor, how much longer will that take? And can that be approved on a more quick basis? I realize you have different processes that you have to go through as far as discussing it and then approving it. But that was part of the warning, is that when we had discussions, if we looked for somebody else to do these last 13 doors, who would we go and how long would it take to bid it out and then present it to you folks? And so in trying to get all of us in as soon as possible, that is an issue we would have to discuss if we weren't going through this. So it might be better if we are able to sit down and have the county attorney, the county administrator, my office, the sheriff's office, circuit court clerk's office.
So does everyone want to remand all of it? Dolly says yes.
I'm fine with it now. Ms. Gunspan explained it. I just wanted to make sure.
Ms. Binder says yes. Mr. Davis?
Yes.
Yes.
Yes, sir.
Okay, well, good luck, gentlemen. May the force be with you. We don't want to pay any money. Alrighty. I guess, sorry. I'm gonna apologize to you. I probably was a little bit too harsh. But this, as Mr. Bell knows, really, really sets me off. So, but I apologize for losing my temper. It's not a godly way to act, and I apologize. And you too, ma'am. I know your name. Okay. Mr. Bell, I didn't say anything mean to you this time. I don't have to apologize to you. I didn't say anything mean to you this time. All right. See you all. All right. Mr. Smolnik, County Administrator's report.
Yes, sir. Thank you. I do have several items for the board to consider tonight. The first one that is listed on the agenda is a proposed code amendment. So July 12th of 2024, I received correspondence from Mr. Charlie Payne requesting a zoning text amendment for blocks and general definition of blocks in our local code. That came into me July 12th. There was correspondence going back between myself and Mr. Payne, indicating that I'm going to be getting some new staff here. Let me see what they want to do whenever they come in. And my recollection or my recommendation was, we understand the 2024 ordinance. There are some things that need to be changed. We'd like to look at those cumulatively. Let's look at them from a holistic approach so we don't miss anything or piecemeal it. So that was my response back to Mr. Payne, and he indicated that he would like to push this forward. I said, Mr. Payne, I will gladly take this to my Board of Supervisors at the October 1st meeting to see what direction they would like to head. So, and I'm going to look to my left here, Mr. Stewart, but the way I look at the code, whenever a zoning text amendment or request is complete, there is a 1 year period in which action needs to be taken by the Board of Supervisors. So conservatively, let's use a July 12th date. So that would mean that if we wanted to look at this along with all the other amendments, we would have to do so before July 12th of 2025. Another option for the board is to consider taking this up independently. Look at it right now and send it to the direct staff. The draft has already been drafted by Mr. Payne. I'm not sure if this is the the best code amendments to put forward, but that is what he drafted. Do we send this to staff and hold a planning commission public hearing and then come back to the board of supervisors and maybe, maybe end of this year? So I'm just looking for some direction from this board, which way you would like to head, individual, or do we want to look at this at the 50,000 foot view with other text amendments?
What's the will of the board to tackle them all?
Tackle them now.
Tackle them now? No. Can't tackle them all now.
So for clarification, the series of amendments that, and I think we've talked about this, but just I want to reiterate, is to really open up the ordinance to the developers, to the engineers, to the landowners. And we've done this in other localities. And where are the major hangups here? Are there inconsistencies in an ordinance that I believe there were still some questions by some board members when it was passed that were not answered before the previous board adopted it. So it's going to be a holistic approach. And, when I've done this in the past, it could take 6-7 months to do this if you want to do it right. So that's what I've done in years past other localities, and it seemed to work. And I would recommend a similar process here at King George.
Sir, if I may.
Right, sir.
Yes, sir. I would recommend that we do not consider this outside of the holistic look, because something we do here could affect one of the other codes that we're looking at. So my recommendation would be that we wait and look at it holistically. We don't decide on this now, that we make it a part of the overall approach.
Mr. Davis?
I concur with that.
Mr. Sullins?
I agree also, because I don't want to set a precedent by doing this and set ourselves up for a whole bunch of exceptions later.
Ms. Bender?
I agree, because reading the code, each chapter reads like a book. So we can't, in the past, we've done it piecemeal, and it doesn't make sense. We need to do it all in a holistic approach.
Mr. Chairman?
Yes, sir.
The only thing I would just bring to the attention of the board, because this was Mr. Payne actually filed an application on behalf of Mr. West to redo the cluster provisions. And the cluster provisions were changed in 2023 in December, as you all recall, which actually prevents a lot of cluster developments and requires you to have interconnection and other things with streets. So a lot of that's for safety, for fire, for police, et cetera. If you decide to look at this within everything, then unless they defer, you actually have to finish that by July, and you might not. And that's the only thing I would mention. You can look at this one. Mr. Payne took the liberty of drafting an ordinance for King George County, and
that was nice of him.
He would like for you to adopt that. You may want to consider his ordinance, and then you may want to enact on that independently, and then do the holistic approach with everything, because that's going to take some time. It was really significant ordinance overhaul that they did, and you may want to look at a lot of things. Mr. Davis has also reiterated to me that he wants to make certain changes a priority, which we're going to work on, particularly this sort of by right stuff that's not paying any profits to the county and doesn't help build schools or anything like that. So tell me how you want to do it, but just be aware there's a timeline if you choose to do this within everything else.
So the board has decided to do it holistically, and Mr. Smolnick, if he has a problem with the timing, he'll bring it forth to us. If you're,
So, if I may, sir.
Go ahead, sir.
And so I understand, I think what Mr. Stewart is saying is that the recommendation is, based on that, is that we do look at this separately because of the previous, that block zoning impact. And the impact there is that we do look at it now and not holistically, because there's a lot that's involved with that. And I mean, back whenever those provisions were put in originally. So
is that what you said?
Well, that's true, but the essence is you've got to act on this independently anyway. You can do this review while you're doing everything else, but that is an individual case that has to be addressed and has to be responded to. And we can do it on the same track if you want to do it that way, but we can't lose sight of the fact that we have a deadline on that one.
Wasn't it already responded to, Mr. Swanton?
It was responded to, but I believe the code states that the board were all motions until and a decision made shall not exceed 12 months. So a decision needs to be made, a code amendment that ultimately lies on the shoulders of the Board of Supervisors. So I'm thinking about this. So if we do run it concurrently, if we wait for the holistic approach and we see that we're coming up on that deadline, you know, I agree with Mr. Stewart. You're going to have to act on this one individually because it was specifically brought to our attention for this specific code section. If by some miracle this holistic approach takes 5 months, we're golden. It can be brought up and finalized, just voted on 2 separate times. If we're coming up against that 12-month barrier, we can run and review them concurrently with one another to make sure there are no discrepancies as we're amending different code sections. But we can always pull this one aside and hold a public hearing at the Planning Commission and Board for this one specifically. So I think there's a safety net for us at the end of the 12-month road. Maybe the recommendation is to review it holistically with the other ones, knowing that we can pull it aside and hold a planning commission and a board hearing prior to July 12th if we're getting up on that deadline. That makes sense.
I would agree with that, just to make sure there's a deadline where if it's not done yet, that you need to initiate the process of the planning commission and the board.
Okay, so let's get a motion on this since there was some different discussion. Is there any objection?
None here.
Okay, there you go. So the next thing you have, Mr. Smolnik?
Is the first meeting in November. It's November 5th. That was the meeting. This is election day. County offices are closed. I've spoken to a couple of you, and I really would like to have a lot of the procurement issues or procurement items that we have in front of us. I don't want to lose any meetings for the rest of the calendar year. So my recommendation would be to, if your schedules allow, to keep it that same week of the election week. I just look at a date. Thursday, November 7th. Does that work for the board? I don't want to lose a date. I don't want to lose a meeting.
So 6th and 7th, I can't do it. I can do it the 4th or the 8th, which is a Monday or a Friday. School board usually meets on a Monday. Are they meeting that Monday? Does anybody know? November 4th?
Yeah, isn't this reserved the day before the election?
The boardroom is reserved by the registrar's office. The only date that's available is the 7th, but we can reserve the Parks and Recreation building.
For the 4th?
I will check into it, yes.
Okay.
So what's the will of the board?
I would go with the 4th or the 7th because at least on the Service Authority side, we need every meeting to pass all the ARPA fund bids, so.
Jared, we're good with either of those? Said I'm good with either of those?
Mr. Robotham is okay with the 4th also.
I would prefer the 4th if that will work. If there's any problems, I'll let you know.
Said either one that works.
Okay. Looks like the general consensus is the 4th, and we'll.
Yeah, I would suggest to keep that one small if possible because it is the day before the election.
Yes, sir. Okay, understood. Thank you very much, Board. A couple more items, Mr. Chairman, if I may.
Okay.
So there's a small group of employees. I know there's typically the county does a holiday luncheon for staff the second Wednesday in December when that is typically held. And that would make this Wednesday, December 11th. up at the Parks and Rec facility. I've working with this small staff, a small crew. I said, let me get with the Board of Supervisors to see if that date works for them so that we can start planning and lining up vendors and whatnot. So for a holiday luncheon for, I think it's a 2-hour period on Wednesday, December 11th. Any objections by the board for that date?
Objection.
Okay, thank you. I'll set that date. So election update, I believe the walk-in so far, 1,498 walk-in voters. I believe that's when they shut their doors. And I forget the number, but a little over 1,000 mail-in ballots so far. So early voting is popular, which takes me to well, let me keep going down my list. There's a budget so Mr. Collins last month asked me to provide a budget update, an outlook for the board. So I've worked with Ms. Cobb, and what's presented in front of you is just what we're thinking of. The blue lines are related to the CIP capital improvement plan, and then the white lines, those are the operating budget major timelines. So this starts with a staff kickoff meeting for the capital improvement plan. As I stated before, CIP and even the operating budget will be a little bit more in depth on staff's end this time, just to increase transparency for the public, so they understand where the money's going and how it is being spent. So this goes all the way through adopting the FY26 budget on May 20th. And some things to note here. I've put a placeholder in here for a Board of Supervisor preliminary budget meeting, maybe a fall retreat in November. I put the 6th. Maybe this is an opportunity to try to understand, as this will be my first budget, I want to understand maybe some direction that you all have. We don't have to do this. I just wanted to put this in as a placeholder for communication between myself and the board. And then also I have a tentative work session later on in April to kind of wrap up the budget. So look this over. If you have any comments, please get them to me. And this is an easy change to make, but this is my best look of what the budget season is going to look like from a couple weeks out till adoption in spring of 25.
So a lot of the citizens have said they wanted the budget to be out quicker than it is in the past. So I would like to be done by the end of April, so that you'd have to move some of them up.
Are we still waiting? Are we still waiting for the state to get the budget for the school system by that point?
Well, yes. So what happens is what most counties do is they approve their budget. Then when the state comes back with all their stuff, if they need to make any adjustments, they do. So instead of just waiting till the end and nobody knows, that's why I just want to compress it a little bit. Anybody have any thoughts?
Nothing. Any thoughts? So you want me to work on compressing it slightly?
Just the end of it.
Okay, just the end of it. Okay, I can revise this. I'll get it back to the board. This is just food for thought at this point, but I can make that. That's an easy change. Yes, sir.
Thank you.
Mr. Stroud, did you have a question on it? So there have been a lot of. The next item is the referendum, the proposal or the referendum that's going to be on the general election ballot for 57 million. Some communication. There have been numerous questions that have been asked, and with some of the early voting, we want to make sure we provide the citizens with an opportunity to help educate them, understand it. There's a lot of variables right now. Will this impact my tax rate? Well, there's so many different factors, to that simple question. So I've got my staff working on. We've compiled a list of questions that we've received from the public. Mr. Rasavi has answered, I believe, most of those today. Providing answers, and I've got staff working on a PowerPoint presentation to help guide people through this. So my recommendation to the board would be to have a board-wide town hall meeting. Potentially, do you want it with just the Board of Supervisors? Would you like the school board there to help educate the people before they go to the ballot, so they understand what they're voting for? And if
so the Board of Supervisors decided on the referendum with the school's input, and I saw all the questions. And we can provide an answer to those questions. A lot of them, the questions are you can't answer. And a lot of them aren't even pertinent to that particular issue because they threw in a bunch of other issues along with an original question. So if you could just answer the questions um, with the information that we have available. And I don't think that we would need the school board at any town hall.
Okay.
I mean, they're more than welcome to come, but we're answering questions from the specific referendum, not all the school board's business. A lot of those questions are school board business.
So if it's just focusing on the 5 members here to my immediate right, would you all like to have a board-wide town hall meeting to help inform the public in the very near future?
If we do, we need to have we do need to have a agenda, specific, so we can stay on just that track.
So what Mr. Collins just said is that a lot of the questions are the school boards to answer. They presented it to us. They're the ones that came up with the estimate of $57 million. That's not our dollar figure. We had no input in the design. We had no input in the number of chairs, the number of classrooms, the number of seats, the number, the ratios. I remember asking, did they include the new teachers, the salaries for the new teachers, which they did not. I remember asking, do they include the cost for the buses to support it? They did not. I remember asking those questions, but they were not included in there. But those are some of the questions that are being asked now. So they were asked that then. I asked it. We had the meeting over at the community center whenever I asked those questions. So, and they still aren't answered. And those are the questions that people are asked. I know I can't answer them. I asked the questions then. I don't have the answers yet. So I just know that the dollars aren't in there. So the 57 million does not cover all the costs that are going to be included. Nor do I feel like the number of students supports it. So I can't answer those questions. I would be one of the ones asking questions. So I'd have to sit out there in that meeting, I think, to try to get questions answered, not answering them.
So
I think it's a good thing that people have those questions. So I believe having a town hall or providing that ability, but we've got the questions. What we don't have is the answers.
Right. So I've gotten a lot of questions myself. I'm sure Ms. Bender and the rest of y'all have, and we've answered the questions that we can answer. But there's a lot of questions that we can't answer, and there's questions in the questions that have nothing to do with the referendum. It has to do with basically the business of this board that wouldn't be taken up in that type of meeting. So what's the will of the board?
Send the questions that go to the school board over the school board, let them answer them, send them back to Mr. Smolnik. And then the ones that we need to answer, we answer. And then once we can agree on the answers, then let Ms. Southall post them maybe.
I'd like to see our staff working with the school system staff to answer as many of these questions as possible. Put a read ahead out there online, and then print and bring copies with us, and do a full board town hall meeting next Tuesday night, so that we can actually stand up and talk. But it would be limited to nothing but the referendum and the school system. I don't want to talk about Amazon. I don't want to get off on 50 different tangents. This is about the school. I feel like we're already late in doing this. I mean, we've got 2,000 people that have voted already, and I feel like they're voting on best guess, not any kind of factual information we provided.
So I would just argue a little bit about best guess, because school board came and presented stuff to us. We asked questions, they answered the answers they had. And so it's a lot of this information is in the public. Val did ask a lot of these questions. And, and some of the answers, some of us disagree with. But I think there's a lot of information out there. And I'm willing to do whatever is necessary for people to do the best they can on their vote, you know, to give them any answers. But there's a lot of answers out there. Just they have to watch the meetings. So it's still the will of the board. I don't know about next Monday.
Yeah, I was at the school board meeting where that came up. I mean, where this was discussed, as where you too, Mr. Sullins, and I remember the school board was concerned that the public wasn't smart enough. And this is in that it's recorded. It's on YouTube. The public wasn't smart enough to vote on a referendum, which that, you know, kind of caught me, but it's the school board's responsibility to educate them if their objective is to have a school and they say we need a new preschool and we need a new elementary school, then they should be able to educate them. That's their job, right?
Yeah, I agree. I think the school board's mission should include educating the public on whether we need a new school and why. But I think our mission should be to educate the public on how much it's going to cost them. To just say $57 million, that doesn't mean a lot. But is it going to be a tax increase? Is it going to be property, personal? You know, how is it going to impact them individually? The school board really can't address that. I feel like that's something we should do. And I agree, there is a lot of information out there, but on Facebook, there's a crap ton of misinformation out there too. And that's why I think it's important that they hear it from us and not, you know, Joe Smith's, and that's just a random name. I don't know Joe Smith, but you know what I'm saying? Somebody's opinion that they've thrown out on Facebook and people are running with that.
I agree, sir. And whenever the superintendent briefs us on their budget, so he could produce, he's gonna have to put a budget together with these teachers, how many teachers, their levels, what their salaries are gonna cost, what their insurance is gonna cost. He needs to put that together anyway for that. So he could put what is it gonna cost for these teachers? How many people is it gonna take to mow the grass? How many lawnmowers do we need to buy for this new school? You know, how many ice scrapers? Do we need a new truck with a blade on it? All this stuff needs to be considered.
I know there's a lot of variables in this that we can't answer, but in all my years on the board, we've never gotten down to ice scrapers at the very low level of figuring out what goes into the school. But I don't mind having a town hall. I mean, I'm going to have one tomorrow, so I don't mind bringing on all the town halls. But it's the will of the board for a joint town hall. I'm doing mine tomorrow, so there. So it's, do we want a joint one or individual ones or whatever? I know I'm having mine tomorrow.
I wouldn't want a joint one because, you know, all that would do would be probably cloud the issue even more.
Concur. Whenever I said ice scraper, I meant snow plow. And yes, you did approve snow plows for the school. They have one on the front of a truck. I think it's a Ford.
So
I think we should do a town hall to educate them on what we do know about it. And I don't think we should do a joint one with the school board, though. I think that would be ridiculous.
I agree.
All right, so that's 3 at least. So when would that be?
Let's do it now.
I think Tuesday was mentioned. Do it now. Let's stay here forever.
November.
Aren't we getting close to 10?
That's Tuesday, October 8th, I believe is the date that I mentioned to y'all. Just as soon as the voters come in, I believe there is a lot of information out there, but some people may not. They may be waiting to vote. I don't know, but I think the sooner the better. So that's just a date that we've looked at. I know I talked to Mr. Sullins, you know, before the meeting. That's the date I'm going to throw out there. It's the will of the board.
Are there any other meetings in this room that night, or would we want to try to maybe meet in the auditorium at the high school or over at the Civic Center so that more people can get in? I like it. Let's go with that.
Well,
can't do it at
we
6
can
in the
limit it.
morning.
We can limit it to a time frame too, like an hour. You know what I mean? So it doesn't go to.
I got doctor's appointments all day, so I can't do it in the morning. So is it the 8th? And could we find out if we can have it in the high school auditorium?
I will get on that first thing tomorrow morning. Yes, sir.
Mr. Dines, you can handle that if that's the case, right?
We can handle anything, Mr. Chairman, exactly.
Okay, all right. So we'll just tentatively do it for, what, 5:30? Tentatively?
5:30? Okay, sounds good. Thank you. Just a couple more items, but they are very important, so I want to focus on these. So the Board of Supervisors retreat that I've been working on setting up, I've heard back. I actually talked to Weldon Cooper Center out of town last week. So we received their initial proposal back, $7,500. Procurement, we reached out to several other universities, all fine institutions here in the Commonwealth, University of Richmond, Virginia Tech, and James Madison University. And I know there were a couple more that procurement reached out to, just did not receive a response back. All with a similar type proposal. Now, the board retreat, the specific agendas will be set once whomever you select starts to meet with you. But the general notion is to help the board work as a cohesive unit, to encourage training amongst the board, what staff can do to better support you and what you can do to better support staff. So that's really the 50,000-foot view. The details will be nailed down. So with the estimates that we got in, UVA Weldon Cooper Center came in at $7,500. University of Richmond, $35,000 to $4,000. Virginia Tech, $5,000, and JMU, they said just under $5,000. Based on my professional experience, University of Virginia Weldon Cooper Center, they are the premier. They're the go-to to go for this. That's why University of Virginia Weldon Cooper Center was at the ICMA conference in Pittsburgh last year, front and center in front of the entire country. So it'd be my recommendation for the board to utilize Weldon Cooper Center to enter into a contract with them, not to exceed $7,500, and then we would go ahead and set up the personal interviews with you, of which the specific agenda for that meeting will be set. I've already talked to some offsite venues. Fort Walker's one of them that I spoke to. They'd be more than happy to host us for that particular event. So. I guess my recommendation is to utilize Weldon Cooper Center for the Board of Supervisors retreat. We're looking to schedule that sometime here in the next month or so, not to exceed $7,500. That is my request for this board.
I'm going to say so moved, and I've actually had experience in several committees with them, and they are very good at mediation and making sure everybody's voice, so you can come to an agreement on projects.
Second.
So that's 2. Is there a 3?
3.
Is there a 4?
4.
5. Okay. You have any the dates?
Do we need a roll call since we're spending money, sir?
Okay, let's go back again. Roll call for that. Mr. Davis.
Aye.
Mr. Stroud.
Aye.
Ms. Bender.
Aye.
Sullivan.
Aye.
Chair votes aye.
So there's no specific date identified. Maybe does the board want to just reach out to me tomorrow with specific dates that may not work for your individual schedules? And I think that's the best way to kind of nail down a common time. Will that work for members of the board?
What month are you looking at?
Here we are, October 1. If we could get this done, if we could get it done before VACO, that's what I was thinking. If we could get it
At the end of October.
end of October, that's no too soon. So middle of November. So what works for you all?
Well, after the VACO, because we'll be up there together, and then afterwards we can have professional.
I don't know what their schedules are, as far as right after VACO. So,
Well, just sometime after.
sometime after VACO. Okay.
So I want to do like after VACO, which will be the 3rd week or 4th week in November.
So I'll propose those dates to them and see if they are available. And following up, thank you very much for all this. And then following up the climate study for the fire department that was requested. So I did hear back from Weldon Cooper Center today. They have 2 individuals who are very well versed at this, and he's given me 3 options to talk a little bit more about what we want to see in this the climate study. So that also is moving forward. So I should have a little bit more information to the board in the very near future. So just to let you know, we are moving forward with that. Lastly, there's a resiliency plan that is at your desk right now. This is something that I inherited. This is a study that was done by the Berkeley Group. So why this is in front of you tonight, talking with the Berkeley Group, the plan is to ultimately submit this plan to the Department of Conservation and Recreation. Once they approve it, it would make us eligible for specific grants. The Berkeley Group asked me to put it in front of the Board of Supervisors for your preliminary approval. I'm not looking for an answer tonight, but if you come back in 2 weeks, Matt, we've looked at this. I don't see any major issues. They, meaning the Berkeley Group, will ship it up to the Department of Conservation and Recreation. Once they approve it, it still has to come back to this board for formal adoption. So your preliminary approval of the draft is not your final approval. But I think what Berkeley Group wanted to not occur was ship it up to DCR. DCR approves it, get it to you for your first read, says there's major flaws in this. So if you could look over that resiliency plan, I will bring this back to the next meeting for your preliminary approval, knowing that it will have to come back to you for ultimate approval in the near future. Mr. Chairman, I know it's a long report, but that's the end of my county administrator's report.
Anybody have anything for Mr. Smolnik?
No, but I just need a clarification so I can read these closed sessions. Are we supposed to read these all together, Mr. Stewart? Or do I read one and then the other? Okay, so I just read the first.
What's the first one?
All right.
Is it Walnut Hill?
Yes. I could do both. I can read it all together. Okay, so I'm just going to read the first 7 and 8. All right, pursuant to State Code Section 2.23711A7 and 2.23711AA, and move that the King George County Board of Supervisors convene to closed session for the discussion of Walnut Hill Residential. Consultation with legal counsel and briefings by staff members or consultants pertaining to actual or probable litigation where such consultation or briefing in open meeting would adversely affect the negotiating or litigating posture of the public body. For the purposes of the subdivision, probable litigation means litigation that has been specifically threatened or on which the public body or its legal counsel has a reasonable basis to believe will be commenced by or against a known party. Nothing in this subdivision shall be construed to permit the closure of a meeting merely because an attorney representing the public body is in attendance or is consulted on a matter. Consultation with legal counsel employed or retained by a public body regarding specific legal matters requiring the provision of legal advice by such counsel. Nothing in this subdivision shall be construed to permit the closure of a meeting merely because an attorney representing the public body is in attendance or is consulted on a matter. That's number 8. I invite the county administrator and chief deputy commonwealth's attorney as needed because they are deemed necessary and or their presence will reasonably aid the board in its consideration of the topics to be discussed pursuant to Virginia Code Section 2.23712F.
Second.
Properly second.
Aye.
Any discussion? No discussion. All those in favor?
Aye.
Chair votes aye. We're in closed session.
Can we go ahead and read the other one?
All right. You all ready? Okay, Ms. Bender.
I move that the King George County Board of Supervisors return to public meeting and certify by vote that only public business matters lawfully exempted from open meeting requirements by Virginia law and in only such public business matters as were identified in the motion convening the closed meetings were heard, discussed, or considered during the closed meetings, and no action was taken on matters discussed in closed session.
Second.
So certified.
There's a second.
Second.
Second, certification, Mr. Davis, Mr. Stroud.
So certified.
Bender.
So certify.
Owens.
So certified.
Certified. We're now in open session. And is there a motion to extend?
I'll make a motion to extend the meeting beyond 10 o'clock.
There's a second.
Second.
Properly second. Any discussion? Seeing none, all those in favor?
Aye.
Chair votes aye. All right, we're going to extend. And the next motion will be for another closed meeting. Yes, sir.
Okay. Pursuant to State Code Section 2.23711A7 and 2.23788A8, I move that the King George County Board of Supervisors convene to close session for the discussion of the Tyler contract, consultation with legal counsel, and briefings by staff members or consultants pertaining to actual or probable litigation, where such consultation or briefing in open meeting would adversely affect the negotiating or litigating posture of the public body, and consultation with legal counsel employed or retained by a public body regarding specific legal matters requiring the provision of legal advice by such counsel. I invite the county administrator and interim county attorney as needed because they are deemed necessary and/or their presence will reasonably aid the board in its consideration of the topics to be discussed pursuant to Virginia Code Section 2.23712F.
Second,
Second.
properly second. Any discussion? Seeing none, all those in favor?
Aye.
Aye.
Chair votes aye. We're in closed meeting again. Yes, ma'am. Go ahead.
I move that the King George County Board of Supervisors return to public meeting.
Second.
Properly second. All those in favor?
Aye.
Aye. Okay. The next motion, and certify by a vote that only public business matters lawfully exempted from open meeting requirements by Virginia law and only such public business matters as were identified in the motion convening the closed meetings were heard, discussed, or considered during the closed meeting, and no action was taken on matters discussed in closed session.
Second.
Properly second. All those in favor?
Aye.
Certify.
Certified.
So certify. So certify.
So certify.
So certified.
Certified. Now we're back to open meeting. So, on the other closed meeting, we're gonna take about a 10-minute recess. Okay? So we'll be in recess for 10 minutes. Okay, let's go. Ms. Bender. I don't know where Sully went. Sully. Oh, it's hot. It's not. We're going. All righty. Ms. Bender.
Ready?
Yes, go ahead, Ms. Bender.
Pursuant to State Code Section 2.23711A7 and 2.23711AA, I move that the King George County Board of Supervisors convene to close session for discussion of Walnut Hill Residential, consultation with legal counsel and briefings by staff members or consultants pertaining to actual or probable litigation where such consultant or briefing in an open meeting would adversely affect the negotiating or litigating posture of the public body, and consultation with legal counsel employed or retained by a public body regarding specific legal matters requiring the provision of legal advice by such counsel. I invite the county administrator and chief deputy Commonwealth's attorney as needed because they are deemed necessary and or their presence will reasonably aid the board in its consideration of the topics to be discussed pursuant to Virginia Code Section 2.23712F.
There's a second? Second. Second. Is there any discussion? All those in favor?
Aye.
Chair votes aye. We're now in closed session.
Hold on, I gotta go to.
All right, Ms. Bender.
Move that the King George County Board of Supervisors return to public meeting.
Second.
Properly second. Is there any discussion? All those in favor?
Aye.
Aye.
Chair votes aye. Certification.
Certified by vote that only public business matters are lawfully exempted from open meeting requirements by Virginia law, and only such public business matters as were identified in the motion convening the closed meetings were heard, discussed, or considered during the closed meetings, and no action was taken on matters discussed in closed session.
Is there a second?
Second.
Okay.
So
Is it
certified.
So certified.
So certify.
Certify.
certified? We're now in open session. Is there adjournment? It's the next meeting.
15 October, right?
October something. Is that? What's the
The 8th, right?
what's the next meeting?
So I move that we adjourn this meeting until the next meeting on October the 8th. The location is to be determined at this time, and the time will be at 6 o'clock. Okay, 5:30.
All righty.
Restate that. I move that we adjourn until October the 8th at 5:30, and a location to be determined for our town hall meeting.
Second.
Properly seconded. Is there any discussion? Seeing none, all those in favor?
Aye.
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 Chair votes aye. We are now adjourned. Thank you, everyone.